Leticia!
Hey, Jack, what's up?
Happy Monday. When you finish with this, I need you to clear off the end cap down there. I got a whole bunch of promotional items coming in. We got to put them somewhere.
Okay, sounds good.
Oh.
You all right, Jack?
Yeah. Yeah, I'm fine. I think it's that stuff that everybody's got going around.
Okay.
Acute coronary syndromes, or ACS, may suddenly strike men and women, often after years of asymptomatic coronary atherosclerosis and plaque formation. As plaque forms within the coronary arteries, several clinical syndromes may also develop, with varying degrees of coronary artery occlusion. Two of these syndromes are non-ST segment elevation acute coronary syndromes, or NSTEACS, and ST segment elevation myocardial infarction, or STEMI. STEMI is generally considered to be more serious and usually develops after a ruptured plaque or an erosion results in an acute blood clot that significantly or completely occludes a coronary artery. Either of these syndromes can, unfortunately, manifest as sudden cardiac arrest and death. It's estimated that half of the deaths from these syndromes occur outside the hospital, making early recognition and rapid response essential. The best outcomes from ACS occur in communities where programs with strong public education, PAD programs, and STEMI systems of care exist. Watch how emergency medical services and hospital personnel use the STEMI chain of survival to provide a system of care that recognizes and rapidly treats the underlying causes of ACS.
What's going on?
I think Jack's having a heart attack. I'm gonna call 911. You get the AED and first aid kit.
Okay.
911, what is your emergency?
I think my manager's having a heart attack.
I see you're located at 459 Commerce Avenue, is that correct?
Yes.
Where is the patient?
He's right here. He was wobbly on his feet, so we sat him down in the aisle. He's having chest pains and his left arm hurts.
Is he awake? Can you talk to him?
Yes, he's awake and able to talk.
I'm going to dispatch paramedics to your location. Stay on the line with me, okay? Don't hang up. I'll have a few more questions to ask you.
Okay.
The first step in the ACS algorithm involves the patient, bystanders, and medical personnel recognizing the warning signs of cardiac ischemia.
We all had basic first aid training and CPR training about 6 months ago, and when Jack said his chest was hurting and his left arm was hurting, that's when the alarm bells went off for me.
Our system uses priority dispatching protocols, which help identify the problem and determine what type of response to send. What the caller described fit the protocol for ACS, which required a high-priority EMS response.
While waiting for EMS to arrive, dispatchers may advise patients to chew 160 to 325 milligrams of non-enteric coated aspirin. This recommendation should be in line with approved medical protocols, and only if the patient has no history of true aspirin allergy or gastrointestinal bleeding.
Okay, paramedics are on their way. Stay on the line with me until they arrive. Do you have a first aid kit with you?
Yes, and I have our AED too.
Great. Is the patient still conscious?
Yes, he is.
Okay, then we won't need to use the AED right now. Ask if he has an aspirin allergy or any recent bleeding from his stomach.
Jack, do you have an allergy to aspirin?
No.
Have you had any bleeding in your stomach recently?
No, I don't think so. No.
No to both questions.
Look in the first aid kit. If it has aspirin, have him chew 2 to 4 baby aspirins or 1 adult aspirin while you wait for the paramedics to arrive.
That brings us to the next step in the ACS algorithm: assessment, care, and hospital preparation.
What happened?
He's been having chest pains for about 10 minutes, and the 911 operator said to give him an adult aspirin to chew.
Sir, how you feeling?
Not so good. It's my chest. I feel like somebody's squeezing it.
Okay. Well, we're gonna help you out, reduce that pain. I'm gonna get a 12 lead. Go ahead and get his blood pressure and put him on a pulse ox. When we arrive on scene, the clock is ticking. I know I've got to assess, but if he doesn't need immediate resuscitation, my highest priority is to obtain a 12-lead ECG, manage the symptoms, initiate transport as soon as possible. Every minute matters. The longer it takes to get to the hospital, the poorer the outcome for the patient. In fact, half the people who die from ACS are dead before they even reach the hospital. So I follow the ACS algorithm closely just to make sure that doesn't happen.
Administer supplementary oxygen if the patient's oxygen saturation value is less than 90%. Give aspirin if the patient hasn't taken any yet and there are no contraindications. It's critical that out-of-hospital healthcare providers obtain a 12-lead electrocardiogram.
Looks like a STEMI.
This early ECG helps classify patients suspected of having an ACS into 2 groups based on ST segment deviation before they reach the hospital. It's preferred that patients with ST segment elevation be driven, if feasible, to a hospital that performs primary PCI. This initial ECG speeds the patient's diagnosis and shortens the time to reperfusion.
Recognizing ST segment elevation on a 12-lead ECG takes training and practice because different thresholds exist for patients depending on their age and gender.
If a STEMI is suspected, EMS should notify the hospital or transmit the ECG for interpretation.
The patient had ongoing symptoms of ischemia, so we administered nitroglycerin sprays every 3 to 5 minutes for a total of 2 doses. 3 is the max. We monitored the patient's blood pressure in between each dose.
Before giving nitrates in any form, make sure there are no contraindications, such as severe bradycardia, tachycardia, or hypotension. Also, confirm that the patient hasn't taken any phosphodiesterase inhibitors for erectile dysfunction in the past 24 to 48 hours. Patients with inferior wall STEMI on their 12-lead ECG can often have right ventricular involvement. This can be confirmed by a right-sided 12-lead. If RV infarction is present or suspected, nitrates in all forms are contraindicated. Clinically, it may be suspected in patients with hypotension, clear lungs, and elevated JVD. If the patient receives nitroglycerin but does not experience pain relief, healthcare providers can consider giving analgesics such as morphine while monitoring the patient's blood pressure and respiratory rate. Use morphine with caution for patients with unstable angina.
County Medical, this is Rescue 1. We've got a STEMI alert. 46-year-old male, chest discomfort started half an hour ago. Current vital signs are BP 104/78 with a heart rate of 96. Pulse ox 95%. He's chewed 325 milligrams of aspirin and received 2 rounds of nitroglycerin sprays, but still says he has chest discomfort. 12 lead shows ST segment elevation of 3 to 4 millimeters in leads V1 through V4. ETA to your facility is 10 minutes.
Rescue 1, we received your 12 lead and your initial report. We'll activate our heart alert system, contact the cardiologist and the cardiac cath team. We'll see you guys in a few minutes.
Let's get ready.
Getting this advance notice really helps us speed treatment of these patients, increasing their chance of survival. We can have the cath lab prepped and ready by the time the patient hits the doors of the ED.
The American Heart Association recommends that EMS personnel transport patients who have a STEMI to the closest appropriate facility that provides reperfusion without delay.
Hi, sir. I'm Dr. Taylor. We're going to take good care of you today.
After we last talked, his pain is down to 2 out of 10. Otherwise, he's stable.
Let's get him to bed.
Right. Studies show that ED evaluations are responsible for as much as 33% of the total time from symptom onset to treatment. We try to reduce delays by having everything ready when the medics arrive. After seeing the 12 lead that the medics had sent, I immediately activated a PCI team and alerted the cardiologist.
When the patient arrives at the ED, we move to the next step in the ACS algorithm. Reperfusion goals for STEMI patients include PCI within 120 minutes after the first medical contact, or fibrinolytics within 30 minutes from ED arrival. The appropriate therapy is defined by patient and center criteria.
Within the first 10 minutes after arrival, the ED staff should provide an immediate assessment of the patient. That includes taking vital signs, getting a brief, targeted medical history, completing a fibrinolytic checklist, and obtaining blood studies. If the early ECG shows no signs of ST segment elevation, then a repeat ECG in the ED is warranted. Staff should also get a chest x-ray within the first 30 minutes after arrival. Draw the STEMI panel. I've activated the STEMI pager and get him to the cath lab as soon as they're ready.
Adjunctive treatments include unfractionated or low molecular weight heparin, bivalirudin, P2Y12 inhibitors, IV nitroglycerin, beta blockers, and glycoprotein 2B3A inhibitors.
Hi, I'm Dr. Taylor.
Hi, how is he? Did he have a heart attack?
I'm afraid so, but his vitals are improving, and we're moving him to the cath lab. This is going to allow us to see inside his heart and his arteries and treat it as well. Dr. Abrams is an excellent cardiologist, and he'll be helping you through the next steps. You'll be in good hands with him, okay?
Thank you.
This patient presented with ST segment elevation of 3 to 4 millimeters in leads V1 through V4. Now, this suggests that his LAD artery is occluded. Immediately opening up the artery with PCI and restoring normal blood flow is my primary goal.
The final link in the STEMI chain of survival is treatment. The preferred reperfusion strategy for STEMI patients is PCI, when patients meet the 120-minute window from first medical contact or 90-minute window from ED arrival to balloon inflation in the catheterization lab.
Hi, Mr. Brennan. I'm Dr. Abrams, your cardiologist. How are you feeling?
Not so good.
Well, hopefully you'll be feeling a lot better soon. I just want to talk to you a little bit about what's going on. I reviewed your ECG, and it appears you have a blockage in one of the arteries to your heart. Now, to open the artery, we need to perform a procedure called PCI that'll help reestablish blood flow to your heart. Basically, we insert a catheter into the artery with the blockage and inflate a balloon to widen the blocked area. We then place a stent to keep the artery open. And the sooner we can do this procedure, the less damage may be done to your heart. Okay?
Okay. I understand. I'm ready.
All right. Well, let's see what we can do to help you get better, okay? All right.
PCI opens the blocked artery with a tiny balloon. Then a stent, or metal scaffold, is inserted to maintain blood flow to the heart. When choosing between this reperfusion strategy and fibrinolytic therapy, hospital personnel must consider. Studies show that treatment delays increase mortality in both groups, regardless of the reperfusion strategy chosen, but were more pronounced among those patients receiving fibrinolytic drugs. In these cases, the more time that goes by, the more heart muscle is lost. The better EMS systems and medical centers work together, and the faster they can deliver treatment, the more heart muscle and patients can be saved.
We had a great outcome with that patient, but we wouldn't have if every link in the chain hadn't been working cohesively.
All the pieces fit together perfectly, and it all began with a call from his coworker. The dispatcher assisted in the administration of aspirin prior to our arrival. We were able to get to him in time, identify a STEMI, and move him quickly to a hospital where they were ready to do PCI. He's back at work today because of it.
Hi, good afternoon. And let's begin na po. Okay lang bang pa-on muna ng mga videos po nila? Ayan, para makita ko po yung mga participants po natin. Okay, so good afternoon. And nurses and doctors all over the Philippines po. So we're gonna have the ACLS na. We'll discuss first the ECG and pharmacology, and then tomorrow po we're gonna have the mega coding na po. Okay? Ayan, and then right after this, we're gonna have the post test. Okay po? So when we talk of ACLS, guys, na there is actually a need na to have that strong foundation na tinatawag na BLF po natin. For a while lang ha. Ayan. Na-mute ko lang. Sorry po. So we need to have a strong foundation, okay, with your BLS, which is the basic, okay, life support po natin. Now, when we talk of ACLS, guys, this means what? This is the advanced cardiovascular life support. Now, when we talk of advanced cardiovascular life support, this is actually expected na alam niyo na kung paano mag-perform ng BLS na. Plus, we're gonna have, okay, let's say the administration of medication as ordered by the physician. Then we're gonna, okay, of course, na kailangan din na i-interpret, i-analyze ang ECG, na when is the best time ba, diba, to let's say activate the code na, or code blue po natin. By the way, for those na hindi pa po alam kung anong ibig sabihin ng code blue, that's where the cardiopulmonary na resuscitation is in need, diba? Yan, need talaga natin na automatic na as soon as possible maka-start na ng compression. Kasi may cardiopulmonary arrest ang patient natin, kaya it's your code blue. Diba? Kailangan niya ng immediate, okay, resuscitation po. Objectives po natin, guys, still we are following the 2020 guidelines na ito yung pinakakailangan po natin. We need to be updated dapat. So basically, it's based on the 2020 guidelines. Tulad ng if you're familiar sa atropine sulfate natin, dati kasi it's 0.5 mg. Ngayon, ang pinaka-latest po na dose is 1 mg. Okay, nawala na po yung 0.5. But still, we have the maximum dose of 3 mg given every 3 to 5 minutes. Na madami pang mga bago po ngayon. Okay, basically, yung camera niya. For a while. Ayan, we have the anatomy. Ayan, pa-mute na lang po ng mga microphones po nila. Ayan, po. Be responsible sa mga ano sa mga microphones po, sorry. So for the anatomy review po natin guys, na wait lang. Pa-mute na lang Ma'am Fatima. Ayan. Wait lang. Meron din isa na naka-on pa ng ano. Okay, for a while. Okay, so we have the anatomy review po natin. I won't be tracing now the systemic circulation, okay, of an adult. Ayan, but rather, of course, no, I'll be emphasizing more on the conduction system of the heart po natin. Now, gaano ba ka-fragile ang heart po natin? Napansin niyo ba, may brain cancer, na? Meron tayong mga bone cancer, 'di ba? Meron tayong vaginal, penile cancer, meron po. Pero magulat ka, no? Wala ka pang narinig na heart cancer. Pero pag ang heart mo, inabuso po natin, 'di ba? So diretso na po, no? Like damay-damay na lahat ng mga systems po natin. Now let's discuss the conduction system of the heart. Before kayo discuss na, gusto ko na ipakita sa inyo, this is the internal view of the anatomy of the heart po natin. Tama ba? We have the major arteries, na? And so aside from that, we have the conduction system of the heart. Now, when we talk of conduction system of the heart kasi guys, so we have the sinoatrial node, the atrioventricular node, the bundle of His, left and right bundle branches, and then we have the Purkinje, fiber po natin. Now, when we talk of conduction system of the heart, now we need to know what are the normal values ba na tinatawag na heart rate po natin. Now, for the conduction system guys, my mnemonic is the mnemonic sublerp. Sulat ka lang ha, pababa. So we have the mnemonic known as the mnemonic sublerp. Letter S, A, B, LRP. Letter S stands for SA node. Next, we have the AV node. Next, we have the bundle of His. Next, we have the left and right bundle branches. And then we have the Purkinje. Ayan, fiber po natin. Now, sabay-sabay nga po tayo. Everybody say SA node.
SA node.
Thank you so much. Thank you so much. When we talk of SA node, this is the primary pacemaker po natin. To be followed by your AV node, which is the secondary pacemaker. Now, if this is the primary, maker po, tas itong isa is the secondary, ayan, pacemaker po natin. Guys, may kanya-kanya ba silang function? Of course, no? Lalo sa firing rate po natin. When we talk of firing rate, kaya pala expected po na pag si SA node ang gumagana, it is actually expected na normal ang heart rate po natin is 60 to 100. Ano nga yung term natin, guys? Pag less than 60, it's your bradycardia. Pag masyado namang mabilis, it's your tachycardia. Now, if that's the 60 to 100, as for the normal heart rate po natin, now I have a question. What is the average heart rate? Ano ba ang average nito? Malamang it's 80. Tama ba? So we have the average of 80 po na beats per minute. Now, we have the AV node po natin, which is the secondary pacemaker. Ayan, ano bang firing rate po natin dito, sir? We have the 40 to 60 po. Meaning to say, you are now entering bradycardia. Guys, di ba iba po yung treatment natin sa bradycardia? Let's say for adult, ano nga yung drug of choice natin in treating and sinus bradycardic adult based on hospital setting niya? It's the atropine sulfate. Tama po ba? Para pag pediatric naman, we have the epinephrine as for the drug of choice in treating sinus bradycardic na mga pediatric patients. Now, we have the bundle of His, left and right bundle branches, and then we have the Purkinje fiber na may ano ba ang firing rate ng Purkinje fiber po natin? So mababa, it's 20 to 40 beats per minute. Na wag mong hintayin guys na si Purkinje fiber na lang ang mag-aaksyon sa katawan po natin. You'll be suffering from severe bradycardia. Kaya pala ang sabi nila, sir, di ba may narinig na tayong AV blocks, right? Na let's say, pag sinabi kong first degree AV block, pag may blockage po tayo sa atrioventricular node, take note, from that 40 to 60, pwede po yung bumaba ng 20 to 40. Okay? Lalo na pag may mga blockage tayo. We have the first degree, we have the second degree, and we have the third degree AV blocks po natin. Okay? Although tomorrow madidiscuss natin yung mga AV blocks. Na basic muna tayo for today's video. Tomorrow po na medyo advanced na po yung ECG po natin, yung mga first up to the third degree AV block or the complete heart block po natin. Sunday na Sunday, pero ECG po yung pag-uusapan natin, di ba? At mga pharmacology po natin. So we have the SA up to, ayan Purkinje fiber. Na matanong ko lang, curious lang ako. Let's have the interview portion. Hello, Sir Ian. Sir Ian, taga saan po si Sir Ian? Taga saan ka, sir? Hindi, nakamute ka, sorry. Ayun, wait.
Taga-Pasig po, sir.
Taga-Pasig. Hi sa mga taga-Pasig. Parang feeling ko Itbulaga ako ngayon eh. Hi sa mga taga-Pasig po na ayan, I've been there to Pasig din. I love I love the place din, 'di ba? And lalo na sa may sa may gimmick na part na yun yung pinaka the best eh, 'di ba sa Pasig. And na-miss ko tuloy ang Manila, guys. I've stayed sa Manila din kasi for almost 10 years na din. And then bumalik lang ako ng Davao during the pandemic. So wala akong choice. Ayan, so we have the na conduction system of the heart. Na-miss ko ang traffic na. Like na-miss ko ang ang chaos ng Manila din, 'di ba? The holdapan, the kidnapan, 'di ba? The robbery, na-miss ko talaga 'yan. Alam mo yung yung faith mo talaga sa Panginoon, no? Mas na-challenge talaga pag nasa Manila eh. 'Di ba yung tipong pagkagising mo sa umaga, yung prayer mo, Lord, sana Lord safe ako makabalik ng bahay. 'Di ba? Yun yung challenge na pag nasa Manila. Ayan, sige po. Now aside from the conduction system, check ko nga ang ating internet connectivity. Please type 3 sa chat box po natin. Ayun, clear naman na, naririnig naman ako for sure. So we're done with the conduction system. So by the way guys, na may mga madidiscuss po tayo, let's say, na yung mga topics such as the word polarization. When we talk of polarization kasi this is the readiness state na tinatawag na body mo at ng heart po. Kasi di ba may mga karugtong yan. Pwede din kasing repolarization or pwede rin kong sabihin na depolarization. So when we talk of polarization, this is the readiness state ng tinatawag na body mo at ng heart po natin. Now, paglalagyan ko yan ng depolarization, I am referring to contraction, I am referring to stimulation. Okay po? Pag naging depolarization yan guys, okay, that's ang body mo nag-action, di ba? May ginagawa, may activity. There is the stimulation. So meaning to say it's more on the contraction. Pag sinabi po natin, okay, repolarization, from the word itself, guys, relax, repolarization, relaxation, or basically the recovery stage. Kaya nga, di ba, pag sinabi kong atrial, okay, depolarization, that's the contraction of the atria. Pag sinabi kong ventricular repolarization, that is the relaxation of the ventricles. Na para hindi po tayo malito sa paggamit ng repolarization, di ba, relaxation. Pag depolarization, guys, meaning to say, there is this increase in the, let's say, stimulation ba? No, may ginagawa po, di ba? May contraction, may stimulation. So again, wag po tayong malito sa paggamit ng depolarization. Then we have the repolarization. Let's say, pagsasabihin ko, guys, we have the P wave. Di ba sa ECG po natin, we have the P wave. Next, we have the QRS. Ayan, next, we have the T wave. Ayan, may mga abnormal ECGs naman po tayo such as, what if may nakita kang Q wave? Or let's say pathologic. It's pathologic, Q wave. And then we have prominent U waves po natin. Ano kaya ang nangyari kay patient po? So we have the prominent U waves. We have the pathologic U waves. And then we have the prominent U waves. We have the PQRST. Now, when we talk of P wave, guys, sabay-sabay nga po tayo. Everybody say P wave.
P wave.
And thank you so much. Ang ganda ng mga internet po natin na like with a split of a second lang na nakarespond agad. So when we talk of P wave po, this represents what? Atrial depolarization. When we talk of atrial depolarization, that means the contraction of the atria. Okay po? So we need to contract first before tayo magre-relax. Tulad ng pag nasa hospital ka, hindi kasi pwedeng relax lang. We need to work and then we need to relax. We need to work and then we need to relax. Kaya nga di ba pag nasa hospital na tayo, di ba pag nag-work tayo sa hospital guys, kung hindi ka man sakitin, ang sick leave mo, nasaan ka sa sick leave mo? Nasa Boracay, 'di ba? Nasa Siargao, 'di ba? Yun yung sick leave mo. Minsan pupunta ka pa ng Metro Manila, 'di ba? Para mag-shopping. That's the sick leave. And if ever, kung healthy ka talaga, pero pag hindi ka talaga healthy, well, yung sick leave mo ay literal talaga na sick leave. Okay? Ayan. So, ngayon po, medyo tumataas talaga ang COVID cases, kaya medyo alarming na naman siya, especially in Davao City. Ayan. So, we have the QR. Aside sa mga crimes na nakikita po natin, yung mga panira kasi yan sa administration ngayon. So, expected na yan. Diba? Tulad nung time ni Duterte din, madami ding ni President Duterte, madami din talaga mga crimes na it's up to them kung paano nila isolve yung crime na yan. Na? So pwede kasi ano yan, mga detractors, 'di ba, mga paninira lang. Na? So we have the QRS po natin. When we talk of QRS kasi, this represents dalawa. This represents, okay, the atrial repolarization. Ayan, repolarization. And aside from atrial repolarization, guys, now of course, now we have the word, ayan, ventricular. Ayan, ventricular, okay, what? Na depolarization. Meaning to say, dalawa pa lang nangyayari dito, sir. Yes, you heard me right. This is the start, okay, of the, ayan, contraction of the ventricles. However, kailangan mag-relax ng atria mo. Di ba kanina, guys, P wave represents the contraction of, okay, the atria. Now, in the QRS po, that's the, ayan, representation din na tinatawag na relaxation ng atria mo. However, kailangan na mag-contract ni ventricles. Now, that's for your QRS. Kaya if you're planning to take the NCLEX po, ito yung mga tanong eh. Underneath the QRS daw, now, aside okay, from knowing na it's your ventricular depolarization, so ang sagot doon, it's your atrial repolarization. Kailangan mag-relax ni atria na in your okay, QRS. Para hindi naman magkaroon ng tinatawag na fatigue, di ba? Ayan, or overusage po. So we have the T-wave po natin. Your T-wave, guys, that represents ventricular. Ayan, ventricular, okay, repolarization. Repolarization po natin. If that represents repolarization, then that's okay. Kailangan mag-relax ng ating ventricles po. Okay? Ayan, sige, so we have the P-wave, QRS, and then we have the T-wave po natin. Now, my question, okay, your pathologic Q-wave. Now, with your pathologic Q-wave kasi, malalaman po natin yan. Why? Na may mga bizarre na wait lang. Ano tong Q-wave na to? Bakit masyadong malaki ang Q-wave natin kaya it's pathologic eh? Na this is actually a sign na ang patient po natin is having an infarction. 'Di ba? Infarction. Oh. Ayan, technique na lang yan. Or basically the patient is having an infarction. It's the myocardial. Okay? It's the cardial infarction po natin. Guys, 'di ba? Pag sinabi nating myocardial infarction, technique ko lang yung infarction po natin. Pero this is the myocardial infarction. Now, with your myocardial infarction, usually kasi it's squeezing na. Ayan, sasabihin po ng patient na, ma'am, ba't parang may nag-squeeze sa chest ko? No, or let's say, ma'am, ba't parang may elephant na nakapatong sa chest ko? Guys, it's squeezing, okay, the chest, okay, of the patient. Iba kasi pag stabbing. Pag stabbing, parang kinukutsilyo, that's angina pectoris. Now, if that is okay, squeezing okay, the chest na po okay, of the patient, then okay, that's the myocardial infarction. Naalala na if hindi po responsive ang patient natin to nitrates, na pag hindi po siya responsive then to rest, then therefore, no, from angina pectoris, biglang nagkaroon ng myocardial infarction si patient po natin. And take note, ano bang difference ni angina pectoris from your MI? Your angina pectoris, guys, it's reversible. However, your myocardial infarction, they are irreversible. Na? Ayan. Next, we have the prominent E waves po natin. Siyempre, this is brought about by hypokalemia. Diba ang technique natin? Hypokalemia. It's your hypokalemia. Diba? Originally, it's hypokalemia. However, para hindi mo lang makalimutan with your NCLEX then, we have the prominent E waves. Guys, pag ikaw ba may hypokalemia, baba ba or mabilis ang heart rate mo? Slow down heart rate, 'di ba? Slower heart rate po tayo. No? So delikado si hypokalemia. Kaya nga 'di ba may mga doctors po or most of them, syempre mag-order talaga 'yan. No, wait lang. Bakit may diarrhea to? No? Bakit may signs of dehydration to? No? So 'di ba magsiserum electrolytes 'yan. Bakit kaya no, let's say bradycardic ang patient. Pagkakita guys na patient is hypokalemic. Baba ang kanyang potassium level po. Everybody say potassium.
Potassium.
Ayan, 'di ba kasi pag sa states guys na pag sinabi mo potassium, hindi ka maintindihan ng mga tao doon. Na kaya we need to exaggerate things po like potassium, na calcium, 'di ba? Na so mga ganun po, na kasi yung mga barkada ko ng mga doon, ng mga travel nurses na alam niyo ba guys, na kaya nga I hope na mas ma-encourage pa kayo mag-abroad. Wanna know why? Travel nurses abroad, na you'll be earning 1 million okay, per month. And then you're gonna work na 3 times per week lang. See? 1 million tas 3 times a week ka lang. So meaning to say, meron ka pang 4 days. As Pinoy, di ba, pwede kang mag-sideline. Mahilig ka naman sa sideline eh, di ba? So roughly, 'di ba, 1.4, 1.5 okay per month ka, no? Sige lang kung may mga tax na 150,000, no? Naman 'di ba? Sa all, 'di ba, lagpas 500,000 eh. Na so amazing amazing na. Kaya nga ngayon, sobrang open na po ang states na kaya if ever you need to take your NCLEX na ASAP as soon as possible. Okay? Ayan, sige po. So we have your the PQR, okay, ST. We have
Sir,
your the
may question.
yes, ma'am.
Nagtuturo din po kayo ng NCLEX, sir?
Yes, ma'am. Pwede kong ibigay ang number later.
Sige po.
Sige, ma'am. Sure. Okay, so we have your, at sabi ko na nga sabi ko feeling ko talaga yun yung tanong ni ma'am. Ayun po. Yeah, we can conduct online po, no, regarding the ano. Kasi may mga online din ako na for the NLE and for the NCLEX din. Na sabagay online din naman kasi ngayon. I have group of experts din. Let's say all over the Philippines po. And yung iba nasa New York na din. So ayun, no, meron kaming online na group. Okay? Ayan. So we have the P wave, QRS, T wave. We have the Q, okay, wave or the pathologic Q wave. And then we have the prominent, okay, U waves po natin. Okay po? Now, discuss ko lang balikan ko lang ang ating slides po. Now, with your ECG, and pharmacology kasi, 'di ba? Naalala mo yung mga codes po natin. Ngayon kasi dapat updated na, dapat by phasic. Ano dapat yung colors ng leads natin, guys? It should be red. Naalala ba 'yon? Yellow, and then we have the green. Ito yung pinaka-updated. Yung white, black, red, hindi na po 'yon, updated. Pag white, black, red, 'di ba yung sa limbs natin? If familiar ka pa, 'di ba? Sa right side, we have the white, black, and red, yung mga limb leads natin. Wala na 'yon. No, outdated na po 'yan, right? Wala na 'yan. Pero may nakikita pa rin akong hospital, ewan ko kung ba't nakakapasa pa rin sila sa sa DOH. Na dapat kasi updated na po by phasic para hindi po mamatay ang patient. It should be red, yellow, green ang nakikita po natin. Guys, can you show me some heart reaction if ito ba yung nakita nyo, yung red, yellow, green? Sa ER at saka sa ICU at saka sa ward. Sige nga. Yung red, yellow, green at hindi na white, black, red. Okay. Si Mr. Van Roy, nakita niya na si red, yellow, and green. Si Ma'am Marilu, yes. Si Ma'am Caroline, yun na yung nakita nila. Okay po? So na-visualize kunwari ito yung tao. Guys, 'di ba kunwari yan yung tao? Dapat ang makikita natin, na limb leads po natin, we have the red, tama? We have the red, no? Yellow, and then we have the green. Ideally. Pero pag white, black, red pa rin, outdated po. Na hindi kayo na-monitor ng DOH. Na baka mag-surprise visit ang DOH at baka masarado, okay, ang hospital po. Okay? Now, with your ECG kasi, we have the ECG paper na tinatawag. With your ECG papers, sir, may tinatawag tayong big boxes. Ito. These are the big boxes. Ayan, big box mo yan. Alam nyo ba ang big box po, that represents 0.20 seconds. However, if you're gonna ask me, sir, bakit ang isang big box ay 0.20 seconds? Kasi po, ang isang big box, guys, that is composed of 5 small boxes. 1, 2, 3, 4, 5. And each small boxes, that represents 0.04. Ilan nga sila ulit? 5. So 0.04 times 5, a total of 0.20 seconds. But wait, that's not our journey today. Diba? Hindi lang yun lang yung task natin. Ang to count per boxes. My goal is for you to easily understand and analyze ECG in a matter of 3 seconds only. I'll be calling you one by one later, especially for the ECG and pharmacology po natin. Alright? Ayan. Kasi pag group activity naman, that's your yun yung mega coding po natin. We pump, sorry we pump admin. Andyan ba kayo, ma'am?
Yes po, sir.
Yes, ma'am. Ano nga yung package natin for today, ma'am? It's BLS, ACLS, and?
Phlebotomy po.
Okay, the phlebotomy. That's nice. That's nice. Magagamit niyo din yung phlebotomy niyo, especially if you want to own a business spa, yung mga clinics po natin, magagamit niyo po siya. Lalo na yung mga certificates na matatanggap. Okay, so we have the ECG paper. Now, sir, paano ba mag-analyze ng ECG? Now, how are we going to analyze ECG? Kasi madami kasi mga businesses ngayon, lalo na sa mga phlebotomy po natin. Yeah, sobrang dami. Sobrang dami, madami na kasi magpapaganda ngayon, guys, Kaya you join our phlebotomy. As in like very siya. Practical siya kasi if you want to own a business, spa, ng mga clinics po, kailangan ng certificate yan. Now, when we talk of analysis, na tinatawag na ano natin, ECG, number one, you tell me the heart rate. To be followed by, you're gonna tell me the rhythm. Next to the rhythm po, okay, we have the P wave. Lastly, we have the QRS. Okay, complex po natin. So we have the QRS. Ayan, complex po. So we have our heart rate, rhythm, P wave, and then we have the QRS complex. Now, when we talk of heart rate kasi guys, i-memorize niyo to ha. So we have the 300, 150, 100, 75, 60, 50, 40, 30, 20, and then 10. Sige nga, i-memorize natin. Ayan, sa mga bahay niyo, start 300, 150, 100, 75, 60, 50, 40, 30, 20, and then 10. Okay, that's for the heart rate. Next, we have the rhythm. For the rhythm kasi, we always, okay, determine, especially the distance. So we measure, ayan, the distance. Ayan, between P is to P or P is to P wave, and then your R is to R wave. Bakit R is to R wave? Kasi what if po ang ECG mo wala siyang P, what if wala siyang P wave ang ECG mo? Doon ka sa R is to R. Pero kung meron siyang P is to P, P wave is to P wave, then you measure their distance. Look at me sa camera. Pag the same ang distance nila guys, ang tawag doon, it's regular. Pag hindi the same ang distance, ang tawag doon, irregular. Pag the same, automatic, that's the regular. Pag not the same, ayan, not the same distance, ang tawag natin, that's the irregular po. So we have the same distance, regular. Pag not the same, it's the irregular. Okay, ang rhythm ni patient. Guys, follow me. Everybody say rhythm.
Rhythm.
Ayan, thank you so much. Next, we have the P wave po natin. Ayan, sa P wave po guys, na-check natin. If the P wave is clear and upright, if that is clear, and if that is upright. Aside from that, we have your often unclear P wave, or what if it's buried preceding to T wave? Na? So unclear and buried. Next, what if ang P wave mo, it's absent and it's purely QRS? Absent daw siya and it's purely QRS. Now, guys, ang focus natin ngayon will be the P wave. If the P wave po, okay, is clear and upright, ang tawag natin dito, it's sinus. Everybody say sinus.
Yes, sinus.
Ayan, thank you so much. When we talk of sinus, malalaman ko yan because if that's less than 150 beats per minute, it's considered a sinus problem. Meaning to say, meron ba tayong sinus bradycardia? Yes. Kasi ang sabi ko, less than 150. Pero pag sinabi kong greater than 150 beats per minute, malamang wala na akong bradycardia dyan. Usually, pag unclear po, and then it's buried, ang term natin will be an atrial problem. Mabibilis ba to? Yes. Take note of the boundary is greater than 150. Ano ba mga examples nito? Atrial tachycardia, or commonly known as the SVT, or the supraventricular tachycardia. Next, we have the atrial fibrillation. Next, we have the atrial flutter, or the atrial flutter. Na mabilis talaga guys pag atrial problem. Pero pag sinabi po natin, okay, let's say absent and it's purely QRS, then therefore ang term natin dito, these are the ventricular problems. Now, let's say ventricular.
Ventricular.
Ayan, thank you so much. They are considered to me as the most fatal, diba? The most dangerous po. Na the most fatal, the most dangerous also. So therefore, we have the P wave. Guys, kailangan maintindihan ang P wave para malaman mo kung ano ang first name ng isang ECG. Tama? Ayan, mamaya, pagsasabihin ko, the P waves are clear and upright. So malamang it's sinus. Pagsasabihin ko, the P wave is unclear and it's buried preceding to T wave. Ang tawag doon, it's an atrial problem. Pag sinabi ko naman, absent ang P wave natin, and it's purely QRS, sir. So therefore, that's your ventricular problem po natin. So once again, we have the P waves, all right? Now, next po guys, we have the QRS. Ito, we have the QRS. Okay, complex po natin. Ipakita ko ang discussion sa QRS with an illustration po for a while. And for a while lang. Okay, for the QRS po natin, so number one, if that is widened, ito yon. If that is why, then guys, this is common to ventricular tachycardia or the VTAC. Na pag wide QRS natin, ang tawag doon nag-VTAC ang patient, ventricular tachycardia. Naalala ko dati, may student ako guys na, oh, you show me your thumb. Sige nga, you show me your thumb. Thumb, hinlalaki, di ba? Ayan, that's your the what? Na the thumb po natin. If idikit-dikit mo yung thumb po natin, guys, alam niyo ba kung anong tawag doon? It's your VTAC. To be specific, it's your monomorphic ventricular tachycardia po. It's your VTAC, all right? Kaya nga pag nag-duty ka sa ICU at nakita mo, wait lang, ba't parang thumb, nag-tak-tak-tak, nag-VTAC-tak-tak na pala ang patient natin. So, ayan, depende din sa VTAC kasi yan, whether if it's polymorphic or monomorphic. Pag isang itsura lang yan, ang tawag doon monomorphic. Pag in multiform, ang tawag natin doon, it's what? Na polymorphic. Next, we have the narrow. Ayan, everybody say narrow.
Narrow.
Thank you so much. When we talk of narrowed QRS, meaning to say nag-SVT ang patient. However kasi, ito yung catch. Now here's the catch. When we talk of SVT kasi, depende talaga yan sa patient natin, guys. Na ang SVT natin, and depende din kasi yan sa institution kung ano yung mga pina-follow nyo ng mga terms. Madami kasi terms ang SVT. So number one, pwede mo siyang sabihin, no, narrow complex tachycardia. It's your the narrow complex or commonly known as your the atrial tachycardia. Okay? So marami siyang name, guys. The same lang yan. SVT or the supraventricular tachycardia, we have the narrow complex tachycardia, and then we have the atrial tachycardia po. Okay? So we have your the narrow. Pag narrow po, it's SVT or the supraventricular tachycardia or the narrow complex tachycardia or the atrial tachycardia. Next, we have the normal QRS. So again, tatlo ang types ng QRS po natin. We have the widened, we have the narrowed, okay, and then we have the normal. Ayan, QRS. Syempre, ang mas gusto natin si normal. Pero hindi po lahat ng may normal na QRS, guys, ay may normal na ECG. Tama? Kasi for sinus bradycardia, normal ang QRS mo. For sinus tachycardia, normal ang QRS mo, pero tachycardic si patient. Okay po? Normal lang ang itsura niya, pero hindi po sa lahat ng oras ay normal ang patient. Okay? Now, that's how you're going to determine, okay, the QRS po natin. So again, paano nga ulit natin i-analyze ang ECG? Number one, you tell me the heart rate. Tama ba? Next, the rhythm. Next, we have the P wave, and then we have the QRS. And then you're gonna tell me the exact ECG reading. So that's the flow po ng ating analysis, ng tinatawag na ECG. Now, let's try to apply. Paano ba i-apply yung mga learnings po natin, sir? Balikan ko lang. Naalala mo ba yung mga binanggit ko regarding atrial depolarization? This is your P wave. Pag ganyan ang itsura ng P wave mo, it's clear and it's upright. So malamang this is a sinus, problem. QRS. QRS, represents, dalawa. The relaxation of the atria plus the beginning of the contraction of your ventricle. Next, we have the T wave that represents the relaxation of the ventricles po natin. So ulitin ko, we have the P, Q, R, S, T. Tama? So P, Q, R, S, T. Now, I'm going to apply now yung learnings na nabanggit ko. Sabi ko, okay, let's try to apply, the heart rate. Paano ba kumuha ng heart rate ng isang patient? Naalala ba 40, 30, 20, and then 10? Alam niyo ba ma-apply po natin yan? Lalo na if maghahanap daw tayo ng tinatawag na QRS that falls on a straight line. Wait lang ha. Maghanap ka daw ng QRS na nag-fall sa straight line. Tignan natin. Ito yung mga straight line natin. Ito yung mga straight line. Ito yung QRS mo. Tama? Ayan. Maghanap daw tayo ng QRS that falls on a straight line. May nakita ka na ba? May nakita ka na ba, guys?
Yes po.
Sana all may nahanap na chart. sana all may nahanap ng the one. Na, ayan. Ito si Mr. Knowledgein. May nahanap ka na bang the one?
Meron na po.
Ay, sana all. Ito si Mr. Ito si Mr. Ian. May nahanap ka na bang the one?
Meron na po.
Sana all. At si the one ay buntis na din, no? Kaya hindi na siya the one, the two na po sila, no? Ako akala ko din talaga sa Bicol, akala ko nahanap ko na yung the one, na scam pala ako. Eh, ganun talaga, di ba? Ganun talaga ang buhay, na sige lang, ang importante, masaya pa rin, masarap pa rin ang mga kinakain, di ba? Kaysa naman bitter ka na sa life, bitter ka na sa pag-ibig, tapos hindi pa masasarap yung pagkain mo, no? Sana all nahanap ang the one. Okay. Hanapan mo na lang ako, sir, ha? Sir Ian. Okay, gusto mo bang malaman ang vital statistics ko? Char. Papuntahin mo na lang siya sa Davao. Ako na bahala. So ayun po guys. Pag sinabi po natin, ayan, maghanap ka ng QRS that falls on a straight line. Ito yon, 'di ba? That's the third QRS. Maghanap tayo. And then, hindi tayo magsa-start na mag-count dyan sa first line, but rather sa second line up to the next QRS. Bigyan ko kayo ng style ha, ganito. Di ba ito yung straight line? Tama? Pero hindi ka pwedeng mag-start na mag-count dyan. Dito ka mag-start na mag-count. Okay po? Up to here. Kasi nandito yung next QRS mo. Oh. Kasi ganito ang rule dyan. You start po, no? Ayan, sa QRS up to the next QRS. Pero to be specific, hindi talaga mismo dito sa first QRS, but rather sa second, okay, na line po natin. Tignan natin. 300, tama, 150, 100, boom, 75. Meaning your QRS na is between 100 and 75. Do you think normal bang heart rate? Yes. Kasi 'di ba guys, 60 to 100 is the normal heart rate. Pag less than 60, bradycardia. Pag greater than 100, it's tachycardia. Okay po? Meaning to say, the next QRS falls between 100 and 75. So I'll gonna assume na ang heart rate ni patient dito is 80. Kasi within the normal range eh. Tama? Basta within 100, okay, to 75 or 75 up to 100. Normal ang heart rate niya. Tama po ba? Now, guys, i-try nating i-apply yung rhythm. Ano nga yung sabi ko? Sa rhythm po natin, you're going to measure the distance between the P is to P and R is to R. Tama po? Bilugan P is to 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 P. I-connect mo yan. Guys, pag-connect po natin, malamang na the same ang kanilang distance. So it's regular. Tama po ba? Now, what if lang ayaw mo ang P wave? E dito sa R, what if choosy ka? E di R, 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 R. I-connect mo sila. The same distance? Yes. Anong tawag dyan? On a regular rhythm. Tama? Pero pag hindi po the same ang kanilang distance, ang tawag doon irregular or may arrhythmia na ang patient po natin. Arrhythmic na ang ECG niya. Okay po? Now, we're done na sa heart rate. We're done na sa rhythm po. Now, let's try to what? No, dissect. Tignan natin ang kanyang P wave if that is clear and upright. Sige nga. O, i-zoom mo. Sir, it's clear and it's upright. 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 This is a sinus problem. And then, tignan mo ang kanyang QRS. Pag may distance po yan, guys. Ito ha, QRS mo. O, QRS. Tama ba may distance pa siya? Yes, may distance pa siya. Malamang hindi siya narrowed. But rather, this is what? Normal. Tama? So guys, napansin mo ba? Everything is normal. No? From the heart rate na down to the QRS, everything is normal. Ano kaya ang rhythm na to? This is your a normal sinus rhythm, commonly known as the NSR. Okay po? Now, papakitaan pa kita ha, ng tinatawag na, ayan, ECG para ma-determine mo ang kanyang tinatawag na heart rate po for a while. Para makabisado na natin to. Tignan natin. Maghanap ka ng QRS that falls on a straight line. May nakita ka ba na QRS nag-fall sa straight line? Meron ba? Itong RD Health Services. Pa-on nga ng camera niyo, ma'am, RD. Ayan, pansinin niyo ha. Ayan, meron ba? Itong second line natin. Tama ba? Pansinin niyo ang second line. Up to here tayo. Kasi hindi talaga siya nag-fall din sa straight line ng ating QRS eh. So guys, pansinin nyo. So start tayo mag-count, hindi dito but rather dito, 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 up to dito. Sige nga, start tayo na mag-count. Sabay-sabay tayo. Start. 300,
300,
150,
150,
100,
175,
75, 60, 50, 40. So meaning it's between 50 and 40. Thank you so much, Ma'am Mary Luz. Ayan, 50, okay, and 40. Meaning to say, kahit sabihin ko pang 50 yan, diba? It's less than 60 po. So malamang this is a bradycardic, okay, patient. Term, guys. Let's say sabihin ko, the heart rate here is 45. Bradycardic, normal, tachycardic.
Brady. Brady.
Okay, it's Brady. You say Brady.
Brady.
Ayan. Kasi we are following the American Heart Association. It should be pronounced as bradycardia. All right? Now, yeah. Arte, ma'am, no? Ayan, so we have it. Ayan, at least, di ba, we're preparing na po, no, for abroad, right? Ayan, alam niyo naman ng, di ba, sa abroad, na grabe yung mga racism nila doon, na. So dapat palaban tayo, guys, na. Kasi ang mga Amerikano biglang, no, what? Na parang sa atin, ha? What mo yung sarili mo diyan, ha? Ayan, arte ka pa, ha? Ayan, pero you can't do that, no? Alam niyo ba sa California ngayon, guys, ito ha, chismis. May isang hospital doon na halos Pinoy na kasi lahat eh. And ang weird lang, guys, kasi nagtatagalog na sila lahat doon. parang na ano na OP na ang mga ang mga true, mga legit na Amerikano, na kasi may isang hospital doon, Diyos ko te, 200 nurses sa isang hospital, Pinoy lahat, 'di ba? Kasama na yung mga ex talaga eh, no? Kasama na yung ex ko doon, no? Sabi niya, no, Diyos ko, parang pumunta lang ako ng iba, parang pumunta lang daw siya ng Manila kasi nagtatagalog din naman lahat ng mga tao doon. Sabi ko, well, that's good, no? At least na hindi ka masyado like, 'di ba, na homesick doon kasi ang dami daw Pinoy doon. However, typical Pinoy, guys, nagsisiraan, 'di ba? Yan, kaya sabi niya, yeah, totoo 'di ba, ma'am? No, kaya sabi ko, yeah, edi makipag-friends ka na lang sa iba, wag na lang sa Pinoy, na. Yan, yeah, sinadjustan ko nga din yung ex ko na maghanap na lang siguro siya ng ano, kung feeling niya, kung ako talaga yung totga niya, the one that got away.
Wow, sana all.
Yeah, kung feeling talaga na, ayan, chismisan time muna tayo, guys, ha, kasi nasusukan ako sa ECG. Tapos kanina habang natuturo ako, parang feeling ko, ako yung nag-chest pain, yung totoo te, nagtuturo ako or ako talaga yung pasyente dito. Alam niyo kasi, syempre ang lunch ko, guys, lechon. Na after that, 'di ba, chest pain agad. Ayan, so basically, guys, na mapapansin po natin dito, tignan nga natin ang ating rhythm. Is it regular or irregular? Tignan mo ang distance nila. Pag the same po ang distance, na kahit wala kang ruler, guys, estimation lang, pag the same ang distance, ang tawag doon regular. Okay po? It's regular. So the distance here or the rhythm here is regular. The P waves, guys, they are clear and they are upright, na, followed by QRS, which is actually what? Na it's normal, na walang problema sa QRS. Pero ang problema lang natin dito is heart rate. So guys, balikan nyo ang sinabi ko. The heart rate is bradycardic. And then, na the P waves are clear and upright. Anong tawag doon? Sinus? What? Sinus bradycardia. Tama? It's sinus bradycardia. Okay po? Can you follow? I-identify mo muna ang heart rate. No, whether if it's normal, bradycardic, or tachycardic. And then tignan nyo din later, no, ang what? Ang P wave, if it's clear or upright. Or what if absent siya? No, para mag-gets natin ang ating ECG po. So I guess we're done na sa ating introduction. Ayan, for a while, i-ano ko lang to ha. I-delete ko lang to. Na? Delete. Ayan. Tapos na tayo dyan. Okay, let's have the first topic na po, guys. Now, for the first topic po natin, for this afternoon, we'll discuss more on the sinus. Atrial din, i-discuss na po natin. And partly, i-discuss na din po natin ang ventricular problems po natin. Okay? Now, with your sinus problem kasi natin, guys, now we have the first problem. It's not actually a problem, but rather this is normal. Now, this is normal. Kasi guys, before natin i-appreciate na yung mga abnormals, we need to understand na ayan, the normals po, para masabi natin pag nag-deviate yan sa normal, meaning to say abnormal na ang result na to. Now, when we talk of normal sinus rhythm, pwede nyo naman picturean. No need for you to take down notes. No? Kahit picture lang, walang problema. Kasi at the end of the day, na I need you to what? Na to understand ECG in a matter of 3 seconds only. Kasi mabilisan yung ECG natin. Kasi pag palamya-lamya tayo, no, hindi natin matutunan ang ECG. And for me guys, it takes practice din talaga. Na, ayan. So when we talk of sinus rhythm, everything is normal here. From the heart rate, it's normal. Rhythm normal, P-wave normal, PR interval normal, SK normal. Na normal lahat yan. Sige nga, let's justify. Tignan nyo guys, maghanap ka daw ng QRS that falls on a straight line. Meron ka bang nakita? Yes, ayan na nag-fall na siya sa straight line. Pero dito tayo mag-start na mag-count. 300, 150, 100, boom! No? Nasa mismong siya, straight line. So therefore, the heart rate here is 75. The rhythm here is it regular or irregular? Tignan mo ang distance ng P is to 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 P. The same ba ang distance nila? Yes. An irregular po, na rhythm po. Tama ba? Yes. I can see P waves. They are clear and upright. Oops, it's sinus. Tama? Followed by QRS, which is normal. So therefore, anong tawag dito? Balikan mo. The normal, sinus rhythm. However, sabi ng American Heart Association, it won't exclude the patient from developing cardiac problem. Okay po? Di porket normal sinus rhythm yan, ay forever healthy ang patient natin. Hindi lahat ng patient, guys, ay MGH no may go home. Yung iba may go home to heaven. Ay, may go home to heaven. May go to heaven, no? So hindi lahat ay papauwi sa bahay. Iba pala yung home nila. Nasa langit na pala guys. Kaya you need to check vital signs every now and then. Nag-check pa ba kayo ng vital signs? Or pakiramdaman na lang guys? Ano yan? Spirit of the glass? Pakiramdaman na lang, no? Yung tipong, Michelle, kunan mo nga ng vital signs sa room 201. Itong si Michelle naman, na madaling tumakbo, di ba? Madaling tumayo, nagmamadaling tumayo at nagmamadaling tumakbo papunta sa room ni patient. Tapos guys, hinawakan lang pala ang door. Okay? Ay hindi talaga siya nag-check ng vital signs. Tapos pakiramdaman, okay, silent naman, okay, sige. So ayun ma'am, normal naman lahat ng vital signs. Wag ka, dinocument pa, 'di ba? Ayan, what's the biggest lie ba sa ating hospital duty? What's the biggest lie? It's the RR of 12. Nobody knows, kung ano ba talaga ang real RR ng isang tao. Kasi nga 'di ba guys, pag nag-check tayo ng vital signs, 'di ba sabay dapat si pulse rate at saka si si RR po natin. Tama? Minsan nalilito kasi tayo Kaya ang technique natin, pag feeling mo na dyspneic ang patient po natin, then walang problema. Diba? I mean like if hindi siya dyspneic or wala siyang dyspnea, right? Pag wala siyang dyspnea, then normal ang RR. Pero pag feeling mo, but parang may siya, may dyspnea upon or on exertion, di ba? Single movement lang, but parang dyspneic agad ang patient po natin. Natutunan ko din yung dyspnea na yan. Hindi pala siya dyspnea guys, but rather dyspnea. You emphasize letter P. Di ba ang turo sa atin sa college po is dyspnea. It should be dyspnea. Kasi now, how are you going to read this? Bakit? Sabi mo bang ania? Di ba it's apnea? Right? Yung orthopnea, sabi mo ba orthonia? Siyempre hindi. Kaya you emphasize letter P. When I attended a seminar sa sa UP, no? It should be pronounced dapat na gano'n. And then for the rash, kinorek din ako dati ng ex ko niyan. Sabi niya wala daw rashes. Okay? Rash lang daw siya. It should be rash all over the skin, of the patient, hindi rashes. Okay? That's the plural form, no? It's a rash. Yes, sabi ko, thank you, ex. Char. At least may natutunan ako sa ex ko na maging strong, di ba? Na maging palaban despite and in spite sa mga nangyari during COVID times. In-invite ko nga siya. Sabi ko, hey, ex, gusto mo bang pumunta ng Kadayawan? Sabi niya, busy pa daw siya. Sabi niya, basta magchat-chat lang daw siya. Gusto ko kasi ng proper closure na although hindi naman kami bitter sa isa't isa. Char. Hindi na kami syempre bitter kasi may kanya-kanya na kami mga jowa. Pero ako wala akong jowa. Na yun lang sa state siguro. Para dapat the one that got away. Para dollars. Ha?
Hindi masyado kayo ng palaya.
Ano daw?
Ako sir, hinahanap ko din. Baka dyan lang.
Yes, baka nasa paligid lang yan ha. Baka nasa palibot lang yan. Okay? Hoy, Mr. Mark, Mr. Eugenio, baka may ma-refer ka. Refer na please, Char. Baka kasi mag-close na yung pek-pek ko. And mahirap na pag naka-close, no? No ID, no entry. Foreclosure na kasi siya, sir. Kailangan
Wala no entry.
kailangan ng ma-depositoan, sir. Diyos ko, Lord. Ayan. So, ayun po. Na, ayan. So, we have here the sinus bradycardia as for our next topic. So, guys, tapos na tayo sa santen. Next, we're gonna have your, okay, the sinus bradycardia. Now, with your sinus bradycardia kasi natin, so we have the heart rate na of less than 60 beats per minute. Tama ba? Pag heart rate of less than 60 beats per minute, na considered as your bradycardia. Ano nga yung drug of choice natin if ever pag adult patient? Guys, pag adult po, tas may bradycardia, it's the atropine sulfate. That's the drug of choice. So we have the atropine. Ayan, sulfate po natin. Tapos pag pediatric patient naman, we have the epinephrine. No? Just ko mabibingi ka guys na sa epinephrine, akin na drug. Lalo na tomorrow, lalo na pag gusto nating let's say i-treat ang patient natin. Kasi this is the most common talaga na emergency drug na pwede nating ibigay para mabuhay po yung patient po natin. Matanong ko lang, na gusto ko lang i-acknowledge yung mga doctors po natin. Any doctors po? Feeling ko ito si Ma'am Bundalian. Feeling ko doctor po ito si Ma'am Rufa.
RN.
RN na. Ayan, gusto ko kasi yung picture mo ma'am pang doktor kasi na baka sign na 'yon ma'am na mag-doktor ka. May mga doctor po ba tayo? We pump, may doctor tayo. Don't worry, hindi ko totoxikin. Hindi ko naman tatanungin ng mga doctors natin. Gusto ko lang silang i-acknowledge, no? And because I have high respect talaga sa mga doctors. Nasaan po yung mga doctors natin? Kasi guys, pinangarap ko talaga maging doktor. No? As in like pinangarap ko talaga. Kaso nung graduate ako, when I took the board examination, naging reviewer na ako guys at naging trainer. So nag-iba na ang pangarap ko sa buhay. Ito na lang maging kabit ng doktor. Ayan, no? Kasi 'di ba, ba't pa ako mag-aaral? Pwede na maging kabit, 'di ba? Ayan, so shout out na lang sa ex ko na nasa Bicol. Ayan. Sino ba dito ang taga Bicol? Kasi pag we pump talaga, na puro mga taga Bicol eh. Na shout out sa mga doctor sa BRT, charm. Ayan, sa mga wait lang, parang familiar to si Ma'am Ruth. Ako po, Albay. Nasa Legazpi po yung ex ko. Ayan, na pinagpalit ako, charm. Hindi ako kasi nang iwan, guys. Na Legazpi. Yeah, I can see familiar names po. Sabi ko feeling ko mga nag-training na yung iba sa amin, na tapos nakita nila yung love story ko do, na witness nila. Don't worry guys, 1 year lang naman kami. Yes po, nag-attend kami ng IB. Yeah, kaya sabi ko, itong si Miss Ruth Ramos, sabi ko familiar talaga tong yung name niya. Hi, it's nice to see you again. So we have the sinus bradycardia. Guys, again, with your sinus bradycardia, everything is normal for the heart rate. Ito yung abnormal dito. Now, ayan, try natin, na i-analyze yung ating ECG on screen. Sige wait lang. With our ECG, on screen, maghanap daw tayo ng QRS that falls on a straight line. At ito yon, tama? Ayan, sige nga, mag-count tayo guys. So 300, 150, 100, 75, 60, 50, 40. So meaning to say it's between 50 to 40. Tama po ba? Ayan, so pwede kong sabihin 45 ang heart rate ni patient dito. Inulit ko lang to ha, para lang para mas clear sa iba. And then we have let's say the rhythm. The rhythm here is what? It's regular, 'di ba? Kasi the same po ang kanilang distance. And then I can see P waves, they are clear and upright, na followed by QRS, which is normal in nature. So therefore, everything is normal here, except for your abnormal heart rate, which is abnormally low. So ang tawag natin guys, it's the sinus bradycardia. Next. Ayan, from the word itself, okay, arrhythmia, ano ba ang pagkakaintindi natin pag arrhythmia? Irregular ang rhythm, pero normal ang heart rate. Okay po? Irregular ang rhythm, normal ang heart rate. Tignan mo the heart rate here is within the normal range. So normal. However, the rhythm here is abnormal. I can justify it. Tignan mo. Dito, okay tayo. Dito, okay. Dito, okay. Ito, pa-shorter ng pa-shorter ng pa-shorter ang distance. Okay na sana eh. 'Di ba? Okay, okay, okay. Kaso pa-shorter ng pa-shorter ng pa-shorter ang distance po. Okay? So therefore, ayan, nagkaroon ng arrhythmia ang patient natin. Now guys, pag sinabi po nating arrhythmia, normal ang heart rate. Sige nga, i-justify ko yan ha. Maghanap ka ng QRS that falls on a straight line. Ito. Tama? Sige, mag-start and mag-count. 300, 150, 100, 75, 60. It's between 75, okay, and 60. So, pwede ko bang sabihin 70? Yes. Na? So, meaning to say, sir, pag 70 ba normal pa rin ang heart rate ko? Yes. However, abnormal ang distance natin. So, therefore, we have your sinus, okay, arrhythmia here. Next po guys, we have the sinus tachycardia. Now, when we talk of sinus tachycardia, ano kaya ang mga possible reasons kung bakit may tachycardia ang patient natin? Anyone? Anyone from the group? What are the possible causes? Let me share to you ha. We have the possible causes kung bakit tachycardic ang isang tao. So number one guys, na may mnemonic will be or na mnemonic, okay, letter F's po natin. Okay, letter F. Number one, we have the fluid loss. There will be signs of dehydration. Aside from that, there will be signs of bleeding. Are you aware that the first sign of bleeding will be tachycardia? Tachycardia po ito causes of tachycardia. So it might be fluid loss. Kaya nga pag may patient ka, bakit tachycardic to? Something is wrong with your patient. Tulad ng nakichismis yung barkada ko ngayon. Sabi niya, Mark, grabe ang COVID na naman ngayon. Na? Diyos ko, ang baba daw ng mga ang baba ng mga O2 sat, pero tachycardic, di ba, nagko-compensate na, so meaning pangit na, okay, ang kalagayan ng patient, unstable na siya. Next to that, now we have the fever. Di ba, pag fever ka, may imbalances po sa tinatawag na temperature po natin with the heat loss, and then we have the heat produced, nagkakaroon tayo ng fever. Now, you are tachycardic. Next po, we have the fatigue. Guys, when we talk of fatigue kasi, we have the stress. Tama ba? Pag may stress, may fatigue, you're always tachycardic. Na? Next, we have the fear or anxiety. When we talk of fear or anxiety, we have the fear of unknown. Pero kasi usually pag patapos na po, 'di ba? Napansin niyo ba? Na ang grabe ng mga bayarin natin. Kaya nga may mga fear at saka may mga anxiety tayo, na ayan, mga due na mga 'di ba, na mga loans po. Na so we have the fear, anxiety, and lastly guys, we have your in pain. Guys, in pain ang patient po natin. Tama? Na when we talk of pain kasi, na it varies talaga, na yung iba naman grabe yung 'di ba? Yung let's say the pain threshold, 'di ba? Yung pain tolerance po, no? Klase-klase kasi 'yan. It may be 10 for you, but it may be parang okay lang sa iba, na lalo na pag maarte-arte or nag-iinarte, 'di ba? Yung 5 lang na pain scale, no, ay parang 15 na para sa mga nag-iinarte. Kaya nga guys, 'di ba nangyayari ba 'to sa hospital? Ma'am, on a scale of 1 to 10, how would you rate your pain? And pag sinabi niya, 15. Bobo ka ba, ma'am? Sabi ko, on a scale of 1 to 10 lang. Ba't mo ako pahirapan, te? 'Di ba? And guys, no, hindi mo kasi pwedeng pagalitan yung patient, 'di ba? Ayan, so ikaw na mag-adjust, 'di ba? Ikaw na mag-interpret, meaning to say in severe pain na ang patient natin. Are you aware that pain is the 5th vital sign? Tama po ba? But pain is not commonly assessed. That is why if I'm going to ask you what is the 5th vital sign which is commonly assessed, you need to answer O2 saturation. Okay, it's the O2 sat which is the 5th vital sign which is commonly assessed. Guys, matanong ko lang, what's the normal O2 sat? It's 95 to 100%. Kaya nga during COVID days, na I hope na appreciate niyo yung value ng O2 saturation, 'di ba? The pulse oxy po natin. Kasi di ba pag pababa ang pulse oxy mo or ang O2 saturation mo, it's actually a warning sign na you're suffering from severe hypoxia, di ba? Etc. and the like. Na medyo nag-worsen na ang COVID mo, di ba? Kaya yung iba na nai-intubate na pagpababa ng pababa ang kanilang O2 saturation. When nga ulit is the best time for you to intubate a patient? So number one, pag less than 84 ang what? No, ang tinatawag na O2 saturation mo, that's the best time na pwede na tayo mag-intubate. And then pag less than 8 ang GCS mo, you are a good candidate na for the intubation. Hindi ka good candidate for Binibining Pilipinas nor Miss Universe, no? Intubation tubo-tubo level, di ba? Ang what? No, ang i-insert sa iyo. Kaya careful po tayo ngayon. Kung feeling natin na walang COVID, may COVID pa ba sa Bicol? May COVID pa ba sa Bicol? Wala na. May COVID pa? Miss Bundal yan. May COVID pa ba? Wait lang. I-unmute natin. Meron pa po. O, diba? Ilan kaya? Isa? Dalawa? Wala na masyado, no? Hindi na ganun ka, ano. Viga, from Viga District. Wait lang. Naka-mute po kayo. From Viga District Hospital. Hello po.
Hi.
Hi, ma'am.
Hi.
Wait lang. Ayun, no? Ayan, from Viga, ma'am, ang Viga ba, ma'am? Ilan kayo, ma'am? Like, ilan ang cases nyo ngayon? Madami pa? Madami naman. Or wala na?
Wala po kaming case.
Walang cases. Wala na. That's nice na. Pero minsan ba ay naka-cater kayo ng case na may COVID?
Yes po.
Tapos bigla nyong tinapon agad, tama? Sa ibang hospital. Yeah, tapon agad, di ba? Oh, refer agad, refer na, no? Wag nang ipababa to, di ba? Lalo na pag nasa ambulance. wag nang ibaba, i-reroute na. Punta na sa government hospital, Diyos ko. Di ba ganun naman talaga nangyayari, di ba? And that's normal, no? Normal. At least ma-manage sila properly. Naalala ko tuloy, no? May mga hospitals kasi, 'di ba? Ano yung code, sir? 'Di ba? May ganun na hospital, guys, na. Kasi pala sa hospital nila like sa ER, no? They don't say code blue, no? Kaya, 'di ba? Paano ba pag sa Bicol? Sa amin Davao kasi tabang, 'di ba? Health, no? Tabang, ay gitabang, 'di ba? Sa inyo, paano niyo nga sabihin 'yon? Ayan, syempre pag Bicolano, 'di ba? Tulong, 'di ba? Tabang. Tabang din. Okay, tabang, no? Tabang na gitabang, 'di ba? Tapos pag tapos pag nabalitaan na COVID positive, wait lang. Wait. Stop mo. Diyos ko, nakarelate ako dyan, no? Wait, COVID pala to, wait, no? Biglang parang time bomb, di ba? Parang bomba na parang pinangdirihan agad, no? So, kasi labo-labo na di ba? Nangyayari talaga yan, guys, no? So, well, hindi ko din kasi mabiblame kasi safety first dapat. Minsan nga dito sa Davao City, guys, the 911, no? No contact sila. As in like no contact. Pag alam nila, baka COVID yan, no contact yan. Kasi kawawa kasi, 'di ba? Kawawa, no, kawawa din yung mga staff, 'di ba? Ayan, kaya umabot sa point. Yung mga guys, yung pag-surge talaga ng COVID, as in grabe ang protocol no ng 911 here in Davao City. No touch policy sila. Lalo na pag hindi talaga no, let's say undiagnosed pa ang patient, like nasa daan lang, no, biglang nahimatay, no touch policy. Kasi kawawa ikaw na nurse, protected ka. Tapos sumakay ka sa ambulansya, tapos yung yung driver ng ambulance, hindi siya protected. So siya mismo magkaka-COVID. Kaya nag-no touch policy. Kasi I have a brother who works with 911 na for almost 5 years na din siya doon. Okay, pero hindi kami close. Kasi nag-away kami, no. Syempre, no, yung mga mamahalin ko mga plant, no. Ni-rearrange ba naman niya? Namatay yung mga mamahalin ko ng mga plants, yung mga variegated. Diyos ko, mas mahal pa sa kanya yon. As in, no? Away talaga kami, guys, no? As in like sobrang away talaga na. Well, that's normal, no? Nag-away talaga, lalo sa plants. Ayan. So we have the causes po natin, guys. So again, we have the fluid loss, we have the fever, we have the fatigue, and then we have your, ayan, the pain. Okay? Ayan, itong si Mr. Ian Mark, tayo lang ng tayo. Baka may makita kaming iba, sir, ha? Pabukol ka rin. Tapos bigla nakaganon talaga eh, no? Sir, ang pangit kasi ng pwesto ng camera mo, no? Nakakatakot. Ayan, ayusin mo kasi dapat ganon. O, ayan, para makita namin yung kagwapuhan mo. Sir, saan ka ba nag-work? Hospital ba yan, sir?
Clinic po, clinic.
Clinic. Doctor po ba si Mr. Eugenio or nurse?
Hindi po, sir. Orderly.
Orderly. That's nice, no? Pag mga macho, alam ko na mga orderly yan. Ito yung magagaling. Ito yung magagaling mag-compress eh, 'di ba? Mga orderly na pag mga payat na, 'di ba, nurses 'yan kasi stress na sa hospital. Pero pag mga macho, alam ko talaga mga orderly to eh, na mga masarap ibigin. Sige po. So we're done na sa ating sinus tachycardia, guys. For a while, balikan lang natin si sinus tachycardia. With your sinus tachycardia kasi, let me correct this. It should be 150, okay? So it's 101 okay, up to 150, not 180. 'Di ba kasi anong sabi natin? Pag 150 and above po, ang tawag doon atrial problem. Pero pag less than 150, tama ba? It's sinus, okay, problem po natin. So meaning to say, with your sinus tachycardia, ang abnormal talaga dito is your, ayan, the rate. Abnormal talaga ang rate po natin. But the rhythm here is normal. P-wave normal, per-interval normal, normal QRS. Now, try natin i-analyze na ang ating, ayan, ECG. Maghanap ka daw ng QRS that falls on a straight line. Sige nga. Saan kaya dyan, guys? QRS that falls on a straight line. Anyone? Ito ba yon? Ayan na, oh. Ayan. Up to here tayo. Okay, mag-check. Tama? Or mag-count. So start tayo. 300, 150, 100. Oops, it's between 150 and 100. Tama ba? If that's between 150 and 100, wala akong sinabing 151, 152 para sabihin nating atrial problem. Nakuha po? Meaning to say, this is an example of a sinus tachycardia. Okay, it's 150 okay, and below. So therefore, this is your, ayan, sinus tachycardia po natin. Okay? Sige. Try nating i-analyze, especially in a moving, ayan, ECG. Adjust ko lang yung camera ko. Ayan, let's have, ayan, your ECG in a moving ECG na po. Kanina non-moving kasi yan. Okay, analyze ko lang, guys, ha. So we have the heart rate here of what? What's the heart rate? What's the heart rate?
70.
70, tama. Guys, baka yung iba na parang, bakit 70? No, mag-count muna sila. 300, 150, 100. May line ba dyan? Wala namang line dyan na. No? So walang line. No? So automatic ang patient din natin, nakakabit na kasi ang patient natin. Hindi sa kanyang kabit, but rather sa cardiac monitor. Nakalagay na ako 70. Tama ba? So the heart rate, nakita ba si 70, guys? Sige nga, if ever kung nakita si 70, please type number 5 sa chat box po natin. Okay, ayan, so nakita si 70. So dito pa lang, guys, sabi mo the heart rate is 70. Okay, this is normal, right? Ang heart rate. The rhythm here is what? Na regular, the same ang distance nila. Tama? And then the P waves na they are clear and upright, followed by QRS na which is normal. So therefore, everything is normal. This is an example of a normal sinus rhythm. I'll play it, ha, i-play ko para ma-appreciate mo si normal sinus rhythm. Okay, next po.
Ready.
Okay. Yes, na. So we have the heart rate of the patient here is 38. So it's bradycardic. Tama po ba?
Correct.
And then the rhythm here, okay, is actually what? Na rhythm here is regular. Tama? The same ang distance. Ayan. And of course, I can see P waves. They are clear and upright, followed by QRS, which is actually normal in nature. Okay po? So therefore, the patient here is having a sinus bradycardia. Great. It's sinus bradycardia. Next po.
Cardia.
The heart rate of the patient is 120. Tama ba? Pag 120 po yan, guys, malamang this is tachycardia. Tama po? Ayan, if this is tachycardia, ayan, makikita naman po natin na regular ang kanyang rhythm. Guys, wag mong tignan ang height ha. What I'm looking for is the distance para masabi mong regular, not the height. Diba? May pandak, may matangkad. No, it's the distance para masabi nating regular. And then I can see P waves. They are clear and upright, followed by QRS. Guys, still this is your sinus tachycardia. Okay? Yeah, sinus pa lang tayo. Okay, this is your sinus tachycardia. But kung nasabing sinus, malamang it's less than 150. And then of course, na the P waves, they are clear and upright. Pag VTAC guys, pag unclear na, or let's say wala na talaga tayong P wave, it's purely QRS. Pag thumb, it's tak, it's VTAC, tak. Okay? Next po. Okay, pansinin po natin, we have a normal heart rate. However, for the rhythm po, it is what? Irregular in nature. So anong tawag doon? Normal heart rate, irregular ang rhythm. Anong tawag? Sinus?
Arrhythmia.
Yes, it's sinus arrhythmia. Ang dami nito sa sa NCLEX, like sobrang dami ng ECG and pharmacology po, na. So we have the heart rate, is 76 normal pero irregular ang rhythm. It's your sinus arrhythmia. Sige po. Yan, i-flash ko sa screen guys ha, and then you tell me, pwede kayong mag-type or pwede kayong magbanggit ng tamang sagot. Okay? Sige po. In a matter of 3 seconds only, let's begin.
Sinus bradycardia.
Okay, great. This is sinus bradycardia. Next. This is the normal sinus rhythm. Normal sinus rhythm or your NSR. Great. Next. This is what? Normal heart rate pero irregular ang rhythm. This is sinus
Arrhythmia.
arrhythmia. Great. Next.
Sinus tachycardia. Sinus tachycardia.
Great po. This is sinus tachycardia. Ang cute lang ni baby. May naririnig akong boses ng bata. Wala nang kokomelon, baby. ECG and pharma na agad. Grabe na yung bata. Tapos nanonood ng ECG pharma. Ayan, so ayun po. No? We're done na sa ating sinus problem. Let's have the atrial problem. Now, before ko i-discuss ang atrial problem, I'll be showing you a video regarding stroke. Why? Because some of the atrial problems kasi can lead to stroke. To be specific, your atrial fibrillation po natin. Okay? So yeah, you watch carefully, you listen carefully also. And you direct your attention po sa ating video known as the American Heart Association Stroke Discussion.
Stroke is a leading cause of death and the #1 cause of disability among adults in the United States. We're going to demonstrate how to quickly recognize the telltale symptoms of acute ischemic stroke and model how to respond promptly with appropriate care and treatment. First, let's review the pathophysiology. A stroke occurs when blood flow to the brain is interrupted, either by a clot, called an ischemic stroke, or when a blood vessel ruptures, called a hemorrhagic stroke. 87% of all strokes in the United States are ischemic. This type of stroke occurs when plaque due to atherosclerosis collects along the walls of arteries, narrowing the arteries leading to or lying within the brain. As in the coronary arteries, disruption of the vessel wall can cause a clot to form, further narrowing or even occluding the artery. Pieces of clot can break off and travel deeper into the arteries and eventually lodge in a smaller vessel and cause a stroke there. This interruption in blood flow ceases function in the affected brain tissue, leading to a sudden onset of symptoms. Brain injury can be minimized and fatalities can be avoided when family members and healthcare providers use the stroke algorithm and follow both the stroke chain of survival and the 8 Ds of stroke care. When a stroke occurs, the stroke chain of survival suggests the following actions: rapid recognition and reaction to stroke warning signs, rapid EMS dispatch, rapid EMS system transport and pre-arrival notification to the receiving hospital, and rapid diagnosis and treatment in the hospital. The 8 Ds of stroke care act in coordination with the chain of survival. As our case study reveals, it's essential that family and healthcare providers follow these steps and work together to rapidly recognize and treat acute ischemic stroke. As you'll see, time is brain. Because many strokes occur at home, it's essential that family members recognize the signs of a stroke and promptly call for help.
It all happened so quickly. 1 minute she was fine, and then the next minute she just fell over. Ellie, honey, what's wrong? Talk to me. It's okay. I'm gonna call 911. Something's wrong. Her mouth was drooping. She couldn't speak. The whole right side of her body just went limp. Immediately, I called 911.
As you can see, the first crucial step in the stroke chain of survival is activating the emergency response system. This is also the first D in the 8 Ds of stroke care, detection of symptoms.
Rescue 21, respond. 3326 Davis Lane, possible CBA.
Rescue 21, copy.
You're responding to a 45-year-old female with notable weakness to the right side and facial droop.
The second link in the stroke chain of survival is rapid EMS dispatch. This is also the second D in the 8 Ds of stroke care.
Strokes receive a high dispatch priority, and we try to get there as quickly as possible. Part of the reason to get to them quickly is in case there's a life-threatening problem, but another part is to get them to a stroke hospital where fibrinolytic treatment can be administered and possibly reverse the damage.
They're here.
Hi, Mrs. Vega. We're gonna help you out. Eddie's gonna take your vitals, and I'm gonna ask a few questions.
Well, the first thing I want to do is rule out any other possible causes for the patient's condition. I discovered Mrs. Vega wasn't experiencing any chest or back pain, and she wasn't having any trouble breathing. Mr. Vega also informed us that she diabetes or seizures. To rule out hypoglycemia, we did a quick finger stick blood glucose analysis. It was fine. I also confirmed she's not on any blood thinners.
EMS should also test the neurologic condition of the patient with a stroke assessment, such as the Cincinnati Pre-Hospital Stroke Scale.
Mrs. Vega, can you smile for me? Okay, Mrs. Vega. Try to close your eyes. I want you to hold your hands out front. Okay. Mrs. Vega, I want you to repeat something for me. Can you say, "You can't teach an old dog new tricks"?
You can't teach dog.
The stroke test definitely showed key abnormal indicators, strong signs of a possible stroke. And Mr. Vega informed us that the symptoms had started 20 minutes before we arrived. I know I had to make decisions quickly.
What are her vitals?
Blood pressure is 190 over 110, heart rate's 110, respirations are at 14, her pulse ox is 95.
Her blood pressure was elevated, but her oxygen saturation was normal.
Mr. Vega, we think your wife is having a stroke. We'll need you to come with us to County
great.
Medical. They're specially equipped to handle the situation. The sooner we get there, the better.
Good. Happened so fast. The EMS team had her checked out in 10 minutes. And they even let me ride in the back, keep her calm and answer any questions.
The third link in the stroke chain of survival is rapid EMS transport to a hospital that is equipped to deal with acute stroke. This is also the third D of the 8 Ds of stroke care, delivery of the patient by rapid EMS transport.
Rescue 21, go ahead.
We are en route with a possible stroke patient, a 45-year-old female with weakness on right side, facial droop on right side, and difficulty speaking.
While we were en route to the stroke center, I radioed ahead so that triage, the stroke team, the ED team could all be fully prepared once we arrived.
Patient's blood pressure is 190 over 110. Her heart rate is 110, and her respiratory rate is 14 without difficulty breathing. Patient's blood glucose level and pulse oximetry readings are within normal limits. The patient's ECG shows sinus tachycardia without ectopy, and according to family members, the first onset of symptoms was approximately 23 minutes ago, 11 a.m., and we have an estimated time of arrival of 5 minutes.
Received, Rescue 21. We'll be ready. Let's activate our stroke team. There is a limited window of opportunity to evaluate the patient, determine eligibility for fibrinolytics, and start the drugs. Getting that advance notice from EMS allows me to notify the ED physician and stroke team so that they're poised to respond when that patient arrives.
The fourth D of stroke care is DOOR. DOOR stands for the effective triage of the patient, including assigning a room.
This is our suspected stroke patient?
Yes.
Okay, let's get her in 3.
Hospital personnel should assess a patient with a suspected stroke within 10 minutes after the patient's arrival in the ED. Some stroke facilities may bypass the ED and take the patient straight to the CT scan, where initial evaluation can take place. The initial evaluation should include assessment of the patient's ABCs, airway, breathing, and circulation, and an evaluation of baseline vital signs. In addition, ED personnel should administer oxygen if the patient becomes hypoxemic while en route, confirm IV patency, and draw blood samples for blood glucose, electrolyte, CBC, and coagulation studies. Even though EMS did a fingerstick blood glucose analysis, hospital personnel should review and verify blood glucose results. ED personnel should also acquire a 12-lead ECG, which may identify a recent myocardial infarction or arrhythmia as a potential cause of the stroke. This should not delay the CT scan unless there is a high suspicion of ACS. The next step in the 8 Ds of stroke care involves the collection of data.
Ideally, within the first 25 minutes of a suspected stroke patient's arrival, I get her history, perform a general physical examination, a neurologic examination, and establish the time of symptom onset. In this case, the first symptoms were about 45 minutes before. Mr. and Mrs. Vega, I'm Dr. Shapiro. I need to ask you a few questions. Can you tell me what month it is?
November.
Okay. And how old are you?
She's 45.
Okay. I understand you had some numbness and weakness on your right side earlier, is that right? After asking a few questions and performing the NIH stroke scale, there were pretty clear indicators of a stroke. We immediately transferred the patient to the CT scanner. I didn't want to delay with any other tests. Since EMS had called ahead on their way to us, we already had our neurologist standing by.
We need to get a CT scan as soon as possible, within 25 minutes of the patient's arrival in ED. Now, you have to remember the clock is ticking, so that means that you must evaluate the scan immediately. Now, our benchmark is that should happen within 45 minutes of the patient's arrival. The CT scan will help me determine if an intracranial hemorrhage is present. Now, if a hemorrhage is present, then our stroke team is going to pursue an entirely different path of treatment than fibrinolytic therapy. On the other hand, if I find a normal CT scan, as in this case, that suggests an acute ischemic stroke is causing the patient's symptoms. So my next step is to determine if fibrinolytics are appropriate for Mrs. Vega or whether I need to pursue other avenues of therapy.
That brings us to the final link in the stroke chain of survival: rapid diagnosis and treatment in a hospital equipped for acute stroke patients. This is also the 6th D in stroke care: decision regarding treatment. It begins by using the fibrinolytic checklist to see if the patient is a suitable candidate for fibrinolytics.
Well, the CT scan shows that there's no bleeding on the brain, and that makes her a good candidate for a drug that can help break up the clot in her brain. But I need to check on a few things first, if I may. With an ischemic stroke, CT scans often look normal within the first few hours of symptom onset. In this case, the CT scan looked normal and there was no evidence of bleeding. Thankfully, we were well within the window of fibrinolytic therapy, which is under 3 hours. But before I recommended that treatment, I performed another neurologic exam and I asked some questions that were part of the fibrinolytic checklist. Mrs. Vega, your right arm, can you lift it? Has the weakness improved any? Okay. And what about your right leg? Can you move it at all? Okay, all right. Can you feel that at all? How about this? Can you feel it? No? Okay. Now, could you read that first sentence for me, please? It's okay.
It's okay, honey, don't worry about it.
The neurologic exam showed no improvement. But before recommending fibrinolytic therapy, I wanted to review the patient's records and to see if there was any pre-existing conditions that might interfere with the drug treatment. These include brain hemorrhage, prior stroke, abnormal blood vessels in the brain, recent bleeding anywhere, any history of blood clotting problems, recent surgery or accidents, any history of diabetes or heart attack, or certain prescription medications. Now, I wasn't seeing any potential problems with the drug therapy. Nancy, what's her current BP?
It's 192/114.
Okay, your blood pressure's still a little bit high, so we're going to give you a drug to help bring that down, okay? Okay, let's give her 10 milligrams of labetalol and try to get her systolic blood pressure down to 185 and her diastolic down to 110. Now, we'll recheck in about 3 to 5 minutes. If it's still elevated, then we need to double it or consider an IV infusion. Just don't waste time here.
Okay, right away.
Okay, Ms. Vega.
If the patient's medical history is acceptable, if the time of onset is generally less than 3 hours, and if the patient's current condition can be managed within suitable parameters, it's time to move to the next D of stroke care, drug.
Mrs. Vega, we'd like to recommend a medication to you that may break up the blood clot that's causing the stroke. But we'd like to talk to you about the potential risks of this medication so you can make an informed decision.
What kind of risks?
There is a small possibility of having a cerebral hemorrhage that's bleeding into the brain. Now, if this occurs, Mrs. Vega's situation could get worse or may even possibly be fatal.
Well, it's only a very small risk, actually, about 5%.
That's right, but you still need to consider it. Now, the upside to this is the drug treatment may break up the blood clot in the brain, potentially restoring or improving blood flow to the affected areas, and that's a good thing.
Studies show that the drug therapy can improve the chances of recovery by 30% if administered within the first 3 hours of the symptom onset.
Now, the window can be extended for some select patients to 4.5 hours, but Mrs. Vega will easily make the 3-hour window, and that's even better.
That number works for me. Sounds like it's worth the risk. Honey?
Okay. Nancy, based on her weight, let's administer our TPA according to our protocol.
You do.
Okay, it's going to take us about an hour to give this medication to you through your IV.
I would do blood pressure and neuro checks every 15 minutes while she's taking the therapy. I'd also monitor her neurologic status.
Good. Looks like you're in good hands. I'll check back with you after the therapy.
Patients who do not meet the time criteria for IV fibrinolytics may be candidates for other forms of acute therapy. While IV RTPA remains as the first-line therapy for acute ischemic stroke, the AHA now recommends endovascular therapy with intra-arterial RTPA, mechanical clot disruption or retrieval, or a combination of these approaches for select patients. As with fibrinolytic therapy, patients must meet inclusion criteria to be considered for this treatment. Similarly, better clinical outcomes are associated with reduced times to reperfusion, but these new treatment options offer the added benefit of expanding the treatment window up to 6 hours from the onset of symptoms. For patients who feel the risk of fibrinolytic therapy is unacceptable, healthcare providers may use aspirin and begin further stroke management. For optimal recovery, hospital personnel must carefully control the patient's blood glucose levels, temperature, and blood pressure. The final D in the 8 Ds of stroke care is disposition. This means rapidly admitting the patient to a stroke unit or critical care unit.
I instructed my staff to transfer Mrs. Vega to the stroke unit once the drug therapy started. She'll be surrounded by a team of people who specialize in stroke. Statistics show that these specialty units provide best practices and not only increase her chances of survival, but really improve her outcome as well. With a little physical therapy and time on her side, she's likely to have a full recovery.
By rapidly recognizing the signs of acute stroke and preventing delay in diagnosis and treatment, you give the patient considerably higher chances for a full recovery.
Okay, let's continue na po. Okay, let's have atrial problems po. Now, with the first problem, guys, now we have the atrial tachycardia. Now, when we talk of atrial tachycardia, this is commonly known as the SVT, diba? So we have the word SVT, or basically, that's the supraventricular tachycardia. Yes, you heard me right. It should be addressed as supra. Kasi pala guys, nung may discussion kami ng mga kapwa ng mga instructors, sabi kasi ni Doc De Lima, which is actually siya ang pinaka-president na American Heart Association. Kailangan palang i-pronounce na ideally, yes, De Lima. So siya ang brother ni Chief Justice De Lima. Dapat pala Supreme Court pala dapat yan. However, ang Philippines hindi nag-adapt sa Supreme Court. So sabi niya, well, i-adapt natin yan sa supraventricular tachycardia. It's the supra kasi ang spelling, pero pronounce as supra. Next, we have the narrow complex. It's the narrow. Then nasulat na natin yan. It's the narrow complex tachycardia po natin. Now, with your atrial tachycardia kasi, your SVT, usually ang pinaka-ano natin dito, the pathognomonic sign is the 150 beats per minute, 170 rather. Pag nagwa-170 na ang patient natin, walang kawala na nag-SVT na si patient. Like sobrang bilis na ng pagtibok ng puso ng patient. And alam niyo ba pag nag-SVT po ang isang tao, nagkakaroon po yan ng V-tach later. No, kaya common nangyayari po yan sa ER, di ba? Now, when we talk of atrial tachycardia, aside sa 170 beats per minute, that's for the pathognomonic sign or the most outstanding sign. Pansinin niyo naman, the rate here is abnormal. The rhythm is normal, however kasi P waves po, they are unclear, di ba? They are unclear and they are buried. So meaning, kaya pala pumasok na ang term na atrial problem. Now, may problem din tayo sa PR interval. So it's abnormal regarding sa QRS natin. Ayan, somehow it's narrowed pa naman. Yeah. So malamang hindi siya normal. So ito abnormal din to. Yeah, narrowed. Okay, so we have the sinus. Ito yung kanina, sinus tachycardia. 'Di ba? Kaya nasabi natin na P wave is clear and upright. Why? Ito na-identify mo to as P wave. P wave, P wave, P wave. So sino to? T. 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 Tama? Ito. T. Ayan. So ito si T. Ito si P. Tama? So TP, TP, TP. Kaya nga di ba always mo maririnig na kanina, the P waves are clear and upright. Kasi na-identify mo na this is my T and this is my P. This is my T and this is my P. Kaya it's clear. O, tignan mo dito guys. O, ayan. Is it a T or a P? Is it a T or a P? Diba? Question mark na. Kasi they are unclear. And they are buried proceeding to T wave. Pag sinabi kong buried proceeding to T wave, guys, dahil gutom daw si T, kinain niya si P. Dahil gutom daw ang T mo, kumain ka ng P. So, ayan, kaya parang hindi na clear tuloy. Okay? Making it unclear, making it buried proceeding to T wave. So we have the atrial tachycardia or SVT or the narrow complex tachycardia. Okay? That's atrial tachycardia. Now, with your atrial tachycardia kasi guys, these are the signs and symptoms po natin. This is really common. Lalo na pag nakita mo sa monitor, oy, nag-170 si patient. Expected, pwedeng asymptomatic, so walang symptoms. But common kasi, pag sa sobrang bilis ng pagtibok ng puso mo, there will be palpitations, right? Yung chest pressure, di ba? The dyspnea, the dizziness, na sobrang bilis na leading to the syncope or the near syncope. Siyempre kasi pag ang patient mo tachycardic, lightheadedness na talaga yan. Okay? So we have the symptoms. Now, ito. Start tayo dito sa vagal maneuvers. Kasi yung isang management kasi madidiscuss naman yun mamaya. So when we talk of vagal maneuvers, guys, ito yung therapies po natin para pampabagal rather, ng pagtibok ng puso. Kasi from the word itself, vagal maneuvers, we're going to stimulate the vagus nerve po. Diba once the vagus nerve is what? Let's say stimulated po. Pag na-stimulate yan, guys, expect that ang result niya will be a slow in the heart rate of the patient, which is actually okay. Kasi sobrang tachycardic ang patient mo dito, like OA ang tachycardia niya. Minsan nga, di ba, like pag nag-90 ka or nag-100, parang feeling mo nga parang OA na yung heart rate mo. How much more pag nag-170 ka, 150 and above? So to decrease po heart rate, so we have the vagal maneuvers. Number one, we have the coughing. Kasi pag nag-cough tayo dire-diretso, guys, napansin niyo ba dati, tapos parang wait lang friend, nalipong ako, nahilo ako friend, di ba? So pag nahilo ka, di ba, meaning to say, na-stimulate po yung yung vagus nerve po natin, right? Nag-slow ang heart rate mo. Ayan, sa ano ba, sa Bicol, kasi ang Bicol napansin ko, pag Bisaya and Bicol, medyo the same, no? May mga words tayo, guys, na halos the same, right? Ayan, next we have the squatting. Squatting is common, especially for pediatric patients. Na? Ayan, if you want to, let's say, para pampabagal ng pagtibok ng puso, nagsasquat yan. Next po, we have the breath holding. Pwede din. Kaya nga, di ba, if you feel like parang, wait lang, parang anxious ako magbe-breath holding lang, no? Deep breathing din. Carotid sinus massage. This is usually done for about 10 seconds. Imamassage po yung carotid artery. But again, these are usually performed by doctors only. Nurses are not allowed to perform carotid sinus massage. The application of cold stimulus to the face, application of ice, yes, common to. I mean like, pwede mo siyang gawin. However, this is not common. This is not common. Mag-X lang ako ha. This is not common kasi sa hospital. Kasi ang laman po kasi ng ref. Ang laman po dapat ng ref. Originally dapat kasi mga ano yan di ba? Dapat may ice, no? However, ang laman ng ng ref ngayon ng mga nurses station, guys. Syempre may mga chorizo, may mga hotdog, di ba? Nagpinapautang kasi ni ni head nurse. Pag hindi ka umutang hanggang diyan ka na lang talaga sa level mo. Kaya dapat umutang ka. Nalala ko dati na may head nurse kami na ang laman ng namin puro ice cream. Tas pautang kasi. Tas ako din, no, kain lang ng kain hanggang sa tumaas ang sugar at naging diabetic. Diabetic girl. Ayan, next we have the Valsalva maneuver. Valsalva maneuver kasi guys is slowly you exhale and then you hold your breath. That's Valsalva. Whenever you're constipated, di ba? We usually perform this. Di ba? Tapos drop eye positive ka pa. Tapos patay agad, di ba? Hindi kita malilimutan. Or kung ang kanta mo guys ay kung wala ka na, malamang hindi ka talaga mamamatay. Like may another cycle na naman. No? Si Cardo ba yun? Diyos ko po. Namatay na lang yung mga kasamahan niya guys. Na like literal na namatay pero siya buhay pa rin siya. Ito pina-perform the Valsalva. But the gagging, syempre hindi. Di ba? Ma'am, suka ma'am. As if magsusuka ka. Di ba? Parang stupid naman yun. Although these are, mga maneuvers po natin. Pero, ang in-encircle ko, ito yung mga acceptable and common here in the Philippines. Yung iba, hindi na po common. What are you seeing right now is of course na the actual checking of the pulse rate. This is the carotid sinus massage. Ina-assess muna ng doctor po natin kung nasaan ba talaga yung pulse ng patient. Ayan, next, if ever kung na-determine na po, 2 to 3 fingers. Ayan, 2 to 3 fingers, ang massage sa tinatawag na carotid artery. Ilang seconds nga ulit yan? For 10 seconds only. Huwag mo i-perform yan ngayon ha. Bahala ka dyan, mag-bradycardia ka. No? You save your own soul. Ayan, huwag mo i-perform yan sa sarili mo. Pero pina-perform ko to whenever I feel so like nervous, di ba? Ayan, lalo na pag nagbayarin na, di ba? Mana-nervous ka bigla. Ayan, naalala ko tuloy sa isang beauty pageant. How are you feeling right now? I feel so nervous because we have nervous system. Ayun, hindi siya nanalo. Pero may point naman si ate, no? Kasi like may point siya. No? Ako naman, siguro, ayan, ang sasagot ko, I feel like, basta. Ayan, carotid sinus massage, pinerform na po natin. No? Or pwede kong sabihin, I have tremors because I have Parkinson's. Ayan. We have the HL flutter or the HL flare. Now, when we talk of HL flare po natin, guys, na sounds like, di ba, fleur, flurry, sounds like McDonald's. Kasi parang may makikita ka mga letter M's mamaya na your atrial flutter kasi or your HL flare, ayan, naabot po ng 50 to 350. O, di ba? May mas worse pa. 350 to 450. Kamusta naman yon? And this will appear na parang perfect sawtooth. Guys, are you familiar with perfect saw? When we talk of saw, di ba lagare? So pag may perfect akay na lagare, that's where the atrial flare or the atrial akay flutter po natin. Okay? Ayan. So pag nakita mo perfect na lagare, it's your atrial flutter or your atrial flare. Next po guys, pwede yung picturean yan. Ayan. Next po, we have the atrial fibrillation. Now, with your atrial fibrillation po natin, ayan, this is your the irregularly irregular. Irregularly irregular. Now, when we talk of irregularly, okay, irregular, okay, kay patient po, like sobrang magulo. Grabe ang dysrhythmia ng patient natin dito. If grabe ang dysrhythmia ng patient mo with your atrial fibrillation, what do you think is the number one complication? Guys, I want you to put an asterisk. We have the stroke. Nakuha? This is your, okay, the complication on the stroke. So magkaka-stroke talaga ang, ayan, ang patient po natin. So again, when we talk of stroke, based sa discussion kanina, I'll be honest, yung discussion kanina po, fast ang ginamit doon. It's the fast, okay, na mnemonic. So these are the warning, diba? The warning signs, ayan, of, okay, stroke po. Now, when we talk of warning signs of stroke, so we have the fast. Ang pinaka-latest po is be fast. Okay, bakit be fast? B-E-F-A-S-T. So these are the warning signs. Now, if ever kung may ganito na si patient, and you watch out. Why? Kasi warning signs of stroke na to. B, we have the balance. There will be loss of balance. No? Or there will be no balance at all. Biglang natumba si patient. Why? Because when we talk of eyes, no, there will be no vision. So there will be a loss of vision kay patient. So we have the balance and then we have the eyes of the patient. Next, we have the fast na mnemonic natin. Ayan. Everybody say fast.
Fast.
Ayan. Thank you so much. Now, next, we have the facial drooping. Guys, pag sinabi kong facial droop, nagsag ang kanyang one side. Na that's your facial drooping. Next, we have the arm drifting. So we have the arm drift. Ang arm drift po, ayan, patient na hands forward, tas biglang, okay, nawalan. Biglang nag-slide, biglang nag-drift, na kasi nawalan po siya ng strength. That's where the arm drifting. Next, we have the slurred speech. When we talk of slurred speech kasi, ano nga yung narinig niya? 'Di ba? Sabi ni patient or sabi ni paramedic kanina, repeat after me. You can teach old dogs new tricks. Sabi ni patient mo, you can do so. Ay, no, positive na. May slurring of speech na si patient. Tama? Pero nung sinabi mo, patient, repeat after me. You can teach old dogs new tricks. Sabi ni patient, you can teach old dogs new tricks. Guys, ngongo si patient. Iba po ang ngongo sa may stroke, no? Pero pag ngongo na tas na stroke pa, yun yung Sorry. Yun yung pinakamahirap na patient. Tama? Ngongo na, tas na stroke pa. Okay po? Hindi naman ako judgmental, pero kasi na, nagkaroon din kasi ako ng guys, ng patient before sa ER. Muntik na ako mapagalitan ng doktor. No? Nako. Akala ko talaga kasi, sabi ko, Dok, parang na-stroke na si patient. Tapos sabi niya, ba't parang na-stroke yan? Diarrhea lang naman yan. Sabi ko, ay wait lang, ulitin ko nga Doc. Sabi ko, sir, how are you? Sabi niya, I'm okay. Sabi ko, ay, okay, sige po. Okay pala siya Doc. No, ako lang pala ang judgmental. Siguro sa sobrang stress ko sa duty, guys. Parang feeling ko na stroke na siya. No? Sorry. Pero that happens kasi. So we have our letter T. Ayan, we have our time to call. Ayan, 911. And kasi pag ganun kasi ng mga topic, guys, naalala ko tuloy yung best friend ko na nasa Canada. yung ngongo ko na best friend. Pwede pala, sir, nurse, tas I mean like, nurse, I mean like ngongo, tas maging nurse? Yes. Yung best friend ko, guys, na number 1 na nurse sa isang hospital sa Canada. Ngongo siya, lalaki. Na. Tapos, however, yes, sobra akong proud. Pero, grabe talaga yung problema ko nung nagkasama kami sa hospital. Like siya yung 11 to 7 shift, tas ako yung 7 to 3. Guys, pagsubok talaga ang duty, di ba? Yung tipong no, kakaupo ko pa lang, feeling ko talaga guys, like sobrang stress ko. Morning enrollment. Sabi ko, oh my God. Sabi ko, ito na ba yon? Ayan. Yes, Sir Knowledge. Yes po.
Sir, yung time, pwede ba, kasi sa experience ko po, yung time ay time that the patient seem normal. Yun po yung sa letter T ko. Okay ba yun?
Okay. Yun yung tinatawag na time 0.
Time 4.5. Para malaman po kung candidate siya for RTPA management.
Sa bagay sir, iba-iba tayo ng Ito kasi this is based on American Heart na yung letter T, it's time to call 911.
Opo. Thank you sir, thank you.
Okay. Ayan. So ayun po. No? So again, these are the warning signs of stroke po natin. So we have the balance, no? We have the eyes, facial droop, arm drift, okay, slurring of speech, and then we have the time to call 911. Okay? Ayan, meron din naman silang tinatawag na mga time 0. However, kasi the time 0, it's not applicable here in sa let's say sa stroke po na na manage na warning signs po natin. Okay? Ayan. Sige. So, ayun po, no? Here are the warning signs of stroke natin, guys. So again, that's for your atrial fibrillation po natin. Okay po. Questions? Wala. Ipakita ko na ang ating moving ECG po natin. Wait lang. Ito, i-change ko lang muna to. Wait lang, i-change ko lang. Okay, let's start. Yan, guys, take note. The heart rate is 176. So again, andun na yung pathognomonic sign which is 170. Tama ba? Ayan. So the heart rate is 176. So malamang grabing I'll assume that this is an atrial problem. And then tignan mo naman ang kanyang rhythm. It's regular. No? However, the P waves po, they are unclear and they are buried proceeding to T wave. You're not sure whether if it's a P or a T, di ba? And then followed by QRS, which is actually narrowed, di ba? Narrowed QRS na tapos 170 and above, no? Common kasi yan na pag 170, it's your SVT or the supra ventricular tachycardia or the narrow complex tachycardia. Next po, guys. Okay, the heart rate here is 390. The rhythm here is irregular. Actually, ang term dapat dito, it's irregularly irregular. Grabe yung irregularities niya. And then, the P waves po, no, malamang, they are unclear, they are buried. So, I'll assume that this is, an atrial problem, di ba? Followed by QRS, which is actually narrowed din to. So, therefore, guys, walang ibang sagot. This is your, Atrial, Atrial fibrillation or atrial flutter? Guys, irregular. Yes, it's for the atrial flutter or the flutter po natin. Next po. Sorry. Guys, pansinin nyo, di ba? The heart rate of the patient here is 271. So mabilis nga. And then the rhythm here is what? Na it's irregular, tama? Pero kung i-compare mo naman kanina, mas kinda regular na to. This is also an atrial problem, right? I can see flutter waves, no? Na parang perfect sawtooth talaga siya lagari, na itsura. So ano kaya to? This is anyone from the group?
Atrial
atrial flutter. Okay, or the atrial flutter po natin. Okay po?
Yes po.
Try natin i-analyze ang moving ECG. You tell me kung ano ang ECG natin. Let's begin.
Atrial tachycardia.
Okay, that's your atrial tachycardia. Next po.
Atrial flutter.
This is your atrial fibrillation. Di ba? Masyadong magulo.
Fibrillation.
Yeah. That's your fibrillation. And then lastly, that's your what? Atrial flutter. Tama ba? Atrial flutter po natin. Sige, I'll start sa sinus up to atrial. Na imimix natin sila. Let's begin. Guys, 170 lang, 120 lang yan. Hindi siya 150 and above. This is what? Sinus?
Sinus arrhythmia.
Sinus tachycardia. Tama? That's sinus tachycardia. Next.
Bradycardia.
Normal.
Normal
Sinus rhythm. Sinus bradycardia.
Sinus bradycardia.
Sinus bradycardia. Okay. Bradycardia. Sabay nga tayo, guys. Everybody say bradycardia.
Bradycardia.
Okay, next.
Sinus rhythm. Normal sinus rhythm.
No. This is sinus what?
Sinus arrhythmia.
Arrhythmia.
Tama? This is sinus
Yes.
arrhythmia. Kasi normal ang heart rate pero irregular ang
rhythm. Okay.
Yes. Next.
Atrial fibrillation.
Atrial fibrillation.
Fibrillation.
Wait lang. Yes, it's
Atrial
atrial
tachycardia.
tachycardia. Tama ang fibrillation, guys. Ito yung fibrillation. Ayan.
Okay. Smaller.
Di ba may mga fibrillatory waves na tayo? Yung parang mga worms na that's your atrial fibrillation. Now, eto guys, perfect na lagare. Ano kaya to?
Atrial flutter.
Atrial flutter.
Okay, that's for the atrial. Ayan, flutter. Okay? Ayan, well I guess na we're done na for today's topic po. And then I'll see you all tomorrow guys, no? At exactly 8 o'clock. Okay lang po ba? 8 o'clock tayo tomorrow?
Okay po.
Yes po. No? So 8 o'clock tayo tomorrow. Yeah. Thank you so much guys, no? Ayan, mag-ingat po. Enjoy the rest of the day, no? Para hindi din namin kukunin yung buong araw nyo. Okay? So I hope na may natutunan po tayo. Ingat po. Mag-ingat po ang lahat.
Thank you, sir. Thank you, sir.
Thank you so much.
Ingat po sir. Salamat. Dawan.
Thank you.
Hello everyone, good afternoon po. Doon po sa enrolled po na BLS and ACLS, if you want to avail phlebotomy po, pwede pa po kayong mag-upgrade. Tomorrow po yun, afternoon. So yung ACLS po natin is until tomorrow morning lang po, until 11 a.m. So kung gusto niyo po mag-upgrade, pwede din po kayo mag-upgrade. Pero kung ayaw niyo po pong mag-upgrade, pwede din po kayong mag-attend until tomorrow phlebotomy, for our phlebotomy. Thank you so much po. See you tomorrow at exactly 8 a.m.
Thank you po. Ingat po.